hematoxylin
Recording
and
in progress.
eosin staining. This is going to be hematoxylin. This is going to be eosin staining, right? And this particular picture that you are seeing, what is this particular cell? This is going to be your squamous cell. This is going to be your cuboidal cell, and this is going to be your columnar cell. So we are having three types of cells: squamous cell, cuboidal cell, and columnar cell. Okay. So these cuboidal cells are going to be present where? They are going to be present with the glands. They are going to be present where? They are going to be present with the glands, and this columnar cells are going to be present in the air. Okay, so that is the thing we have discussed. Video visible now? Okay, so we are having squamous cell, we are having cuboidal cells, we are having columnar cells, right? What is the function of this squamous cells? Suppose someone is having cancer, right? What is the most common cancer? Like the squamous cells are responsible for the protection. So someone is having a cancer of mouth. What is going to be the cancer? That particular cancer is going to be squamous cell carcinoma, right? These are the protective cells. Squamous cells are going to be the protective cells. So whenever we require protection, wherever we require protection, like on the skin, most common cells, most common cells will be squamous. So what is the most common cancer that can happen? Squamous cell. Your mouth will be having, it requires protection. You are eating a lot of things, right? So it requires protection, and for that particular purpose, we are going to have what? Squamous cells will be there, right? Third thing we are having is about the columnar cell, and this cuboidal cell. Cuboidal cells are going to be present in the glands. Where do we have glands? Where do we have glands? In the inside the body, right? In the GIT, we are having glands, and the cancer of these things is known as adenocarcinoma. The cancer of these things is known as adenocarcinoma. Okay, so anytime you have a glandular cancer or cancer of cuboidal cells, that is considered to be adenocarcinoma. Okay, these are the only three cells we are having, right? How many layers do we have? On the basis of layers, we are dividing these cells into multiple classes. Like we are having simple cells. Okay, the simple cells can be having a single layer. When we have a single layer, this is known as simple cell. When we have multiple layers, this is known as stratified. Multiple layer is known as stratified. Multiple layer is known as stratified. Tomorrow I am going to teach you about dermatology. There we are going to discuss about stratum corneum, stratum lucidium, stratum granulosum. So what is the meaning of strata? Strata means layer. What is the meaning of strata? Strata means layer. So here we are going to have multiple layer, that is going to be stratified. Okay. And third we are having is pseudo stratified. Pseudo means false. Pseudo means false. Stratified means there will be layers, right? So here you will be having a single layer will be there. A single layer will be there, which is appearing as stratified, which is appearing as stratified. This is going to be the pseudo stratified epithelium. This is going to be the pseudo stratified epithelium. Okay. So we are having cell. Multiple cells are going to make tissue. This study of tissue is known as histology. We are having three types of cells on the basis of shape. We are having, what are the three types of cells? First one, squamous. Second one, cuboidal. Third one, columnar. Only three cells you have to remember: squamous, cuboidal, columnar. All the body organs. They will ask you what is the epithelium over there. Okay, you have to remember either it can be squamous, either it can be cuboidal, either it can be columnar. If they are talking about cuboidal, this is going to be concerned with the glands. If they are talking about squamous, this is going to be concerned with the most resistant and protective cells will be there, right? Columnar will be present in your areas, right? Now, what is going to happen if they are present in a single layer? Suppose this is a single layer. So we call it what? We call it simple squamous epithelium. If they are present in multiple layer, what we would be calling them? If this squamous is present in multiple layer, this is going to become what? Stratified squamous epithelium. If we are having columnar cells and this columnar is going to be present in the layer, this is going to be considered as stratified columnar cells. Sometimes there will be a single layer which is appearing as multiple. Okay, sometimes there is going to be a single layer which is appearing as multiple. This is known as pseudo stratified. So we can have pseudo stratified, and whenever the keratin deposition is over there, this is considered to be as keratinized stratified epithelium. Okay, you understand? समझ में आ रहा है, right? What is the meaning of this particular thing? Simple, stratified, pseudo stratified. What is the meaning of these things? Right? This is the thing, right? Now what we are going to have, we are having different kind of cells. We are also having, right? On the basis of these cells, how many types of tissues do we have? How many types of tissue do we have? We are going to have how many types of tissue? Four types of tissue. First one is epithelial. Second one is connective tissue. Third one is muscular, and lastly, remember what we have discussed. Cell is going to be the basic unit, and multiple cells are going to make tissue. And what is a tissue? Tissue is a group of cells which is performing a similar function. Tissue is what? Group of cells which is performing a similar function. Let's talk about heart. Heart is a group of cells performing what? Similar function. Let's talk about liver. Liver is a group of cells performing a similar function. It will become what? Tissue. You are having kidney, you are having brain cells, right? So all this group of cells which are performing similar function is going to become what? Tissue, right? And these tissue are going to make what? Organ. These tissues are going to make what? Organ, right? Like liver, kidney, they are going to be the organ, right? So we are having four types of tissues in the body. These are going to be the first one is epithelial, second one is connective, third one is muscular, and lastly we are having nervous tissue. Epithelial tissue कहाँ होता है? Where is the location of epithelial tissue? Remember, they are going to present in the coverings of your body. Your skin, your mucosa, it is going to have what? Epithelial tissue. It has a function of protection again. It is going to be responsible for the protective functions. Protective functions, right? And cancer of these cells is considered to be as carcinoma. Cancer of these cells is considered to be as carcinoma. Whenever you have a cancer of epithelial cells, this is considered to be as carcinoma. Now we understand what is carcinoma. Carcinoma is the cancer of epithelial cells. Okay. Second thing, what is squamous cell? If the cells are squamous, we call them what? Squamous cell carcinoma. If the cells are cuboidal, we call them what? Adenocarcinoma. Now we understand. So if someone is having cancer of GIT glands, this is considered to be as what? Adenocarcinoma. GIT, you will be discussing about adenocarcinoma. So this is going to be the basic understanding. Once you have the basic understanding, you need not to mug up anything, right? So this is going to be the first thing. What is the connective tissue? Examples of connective tissue? Connective means they will be providing connections in the body, right? So what is the thing which is going to provide connections in the body? Blood. Very good. Blood is a connective tissue, right? It is a group of cells. What are the cells? RBC, WBC, hemoglobin, all these things are what? Cells, right? So it is a group of cells which is transporting substances all around the body. This is going to be considered as tissue, right? We are having muscles, we are having bones, not muscles. Muscles are going to be muscular. We are having bones, we are having ligaments, right? We are having bones and ligaments, they are connected with the tendons, right? All these things are going to be what? Tissue, right? Blood can be having two components, right? Blood can have WBCs. So if you have cancer of WBC cells, this is going to be leukemia. WBC cell cancer is leukemia, and they are having lymph. So lymph cancer is going to be lymphoma. I'm just trying to Google it. Okay, it's a high time. Only few days are left for the examination. How many days? 82 days. Very good. Countdown is going on, right? So few days are left for the examination. Even if you start today, you are able to pass this exam, right? Then we are having muscular tissue. What are the muscle we are having? Skeletal, cardiac, and smooth muscle. We are having three types of muscles: skeletal muscle, cardiac muscle, and smooth muscles, right? And then we are having the nervous tissue. Nervous tissue is going to be what? Central nervous system and peripheral nervous system. And this peripheral nervous system means it will be present on the periphery. Central nervous system means what? What is present in the center? What is present in the center? You are having in the center brain. In the center, you have the spinal cord. So, brain and spinal cord are considered to be as central nervous system part, whereas whatever is in the periphery is going to be considered as peripheral nervous system. Okay, so we are having this PNS, and one part of PNS is going to be what? Autonomic nervous system. Okay, so this is your nervous system is also a type of tissue. It will be having same tissues. Okay, we can have central nervous system. We will be discussing this particular thing in the last, right? And then we are having PNS, which is having somatic and autonomic part. And this autonomic will be having further two parts. What are the two parts of autonomic nervous system? These are going to be cholinergic and adrenergic. What is the other name for cholinergic? You're done with pharma? So what is the other name for cholinergic nervous system? This is going to be parasympathetic nervous system. PSNS is what? Parasympathetic nervous system. PSNS is what? Parasympathetic nervous system. Right? Whereas the second one is going to be adrenergic. This is going to be your sympathetic nervous system. Why we call it adrenergic? Why we call it cholinergic? Because see, okay, here parasympathetic is going to be rest and digest system, whereas sympathetic is going to be fight or flight system, right? So parasympathetic is rest and digest, sympathetic is going to be fight or flight system. Okay, this parasympathetic will be having neurotransmitter what? Acetylcholine. If the neurotransmitter is acetylcholine, can I call it cholinergic system? Choline, you can call it cholinergic system. Here, it is going to be sympathetic will be having fight or flight response. Fight or flight response. So, we can also call it adrenal. The neurotransmitter here is going to be what? Adrenaline. Neurotransmitter is adrenaline, epinephrine, norepinephrine. So, can I also call it fight or flight response? Of can I also call it adrenergic system? Yes or no? So, how many types of nervous system do we have? In general, we are having how many types of nervous system? One is going to be, second one is going to be peripheral. Peripheral will be having important part that is working automatically. Can you control your sympathetic nervous system? No, you cannot. Can you control your parasympathetic nervous system? You cannot, right? So this is going to be central. This is going to be autonomic or automatic nervous system. What are the outflow? This is going to have cranial nerve 3, 7, 9, 10, and S2, S3, S4. This is going to be sacral 2, 3, 4. Craniosacral will be there. Whereas here in sympathetic, all things will be thoracolumbar. Between the thorax and lumbar, whatever is there is going to be sympathetic part. Okay. What are the two receptors we are having in the cholinergic nervous system? This is going to be muscarinic and nicotinic. Whereas, what are the two receptors we are having in the sympathetic nervous system? Alpha and beta. Alpha and beta. So let's try to understand this muscarinic receptor. You just remember these three words. You have studied about these words in pharma also. Yes. GS, GQ. Yes or no? GS subunit. Always remember GS in smooth muscle. Just if you remember this particular thing, no need to mug up anything. Okay, just speak with me. GS is going to do what? In smooth muscle, it is going to do relaxation. In cardiac muscle and skeletal muscle, it is going to do contraction. Right? GQ is going to always increase the calcium, and function of calcium is going to be contraction. Q for contraction, right? And GIG0, I means inhibitory. It is going to do what? It is going to do the relaxation part. It is going to do the relaxation. Is that okay? No issues with this. So what is going to be the function of GS? Everyone speak. GS is going to do in smooth muscle. It is going to do relaxation. In cardiac and skeletal muscle, it is going to do contraction. Whereas GQ is going to increase what? Calcium. GQ means contraction. GIG0 means relaxation. GIG0 relaxation. GQ is going to be contraction. So I'm going to write certain cholinergic nervous systems. What are the things we are having? Like what are the receptors we are having? So we are having M1. What else? M3, M5. Don't write, just try to understand this first, then you can write M2 and M4. Right? So these are going to be the things we are having. These are going to be the things we are having. Don't write and make some mistakes. Okay, so don't write. Okay, we are going to have M1, M3, M5, M2, M4. What are the receptors we are having? M1, speak. M1, M3, M5, M2, M4. Remember this M1, M3, M5, they are going to be which type of subunit? GQ. And GQ means what? Now see, GQ means contraction, right? GQ means contraction. This M2 and M4 is going to be GI subunit or G0 subunit. GI, G0 means relaxation. Relaxation. Okay. Now this M1 receptors are present there. What is the location of M1? They are going to be present in the CNS and in the GIT in the stomach. GIT in the stomach. GIT, it will be present in the stomach. In the stomach, it is present in the GIT. What is the location of this M3? M3 is going to be present there. M3, you can think about your body from the pupil. It will be present in the pupil first, then it will be present after the pupil. There will be salivary gland, so it will be present in your salivary gland. Okay, then it will be present in your bronchus. What are the muscles that are coming? You can remember them. Then in the bronchus, after the bronchus, you have what? GAT, and then you have what? Bladder and bowel, right? Bladder and bowel. These are going to be the GQ type of subunit, right? And M5 is also going to present in your CNS. M2 is going to be present at two places. What are the two places? Heart. First thing is heart, and second one is kidney. Okay, not kidney. In heart, you can remember M2 is going to be present in two places in the heart. What are the two places? One is going to be SA node. Second one is AV node. Second one is AV node. So we are having SA node, AV node. Here you will be having what? M2. And M4 is going to be present in the CNS area. Right? So let's try to understand what is going to happen whenever you are going to have activation of cholinergic system. Whenever you are going to have activation of cholinergic system, what is going to happen in your body? That is, once you understand this, everything will be easy. Just try to understand this. What I'm teaching you, I'm teaching you about the basic nervous system, right? What is the basic nervous system we are having? And these are the receptors. They are working automatically. You do anything. Whenever you are resting and digesting, this system will be working. Whenever you have activation of this particular system, you will be having functioning of these systems anytime in the day. Okay, like you have, like some people are smoking, right? So what happens when a person is going to smoke? Smoking will be having what? Nicotine. Nicotine will be activating your nicotinic receptor, and nicotinic receptor will release what? It is going to release the neurotransmitter. What is the neurotransmitter? Acetylcholine. Now see, now you tell me what is going to happen when you have more acetylcholine in the, when you have acetylcholine, what is going to happen? This system will be activated, yes or no? These receptors will be activated. So what is going to happen when you have M1 activation? You will be having M1 present in the CNS. So when you smoke, what is going to happen? Those people who are taking nicotine, what is going to happen? They will be having increase in cognition. Increase in cognition. Second, they are present in GIT. So what is going to happen? GIT glands will contract or relax. GQ means contract. You will be having increase in the acid release, right? Third thing we are having it present on the pupil. So what is going to happen whenever you are going to have, whenever you are smoking? What is going to happen? Contraction or dilatation of pupil. This is also known as meiosis. What happens to salivary glands? You have seen those people who are chewing tobacco or tobacco products, right? What they are doing every time? They are spitting here and there. They are having what? Contraction of which glands? Salivary glands, leading to salivation. Right? Saliva will be more. What happens to bronchus? Constriction or dilatation? Now you know GQ means constriction, bronchoconstriction. Bronchoconstriction will be there. What happens in GIT? The function of GIT, lower parts of GIT is what? Peristalsis, right? So whenever this person is going to smoke, what is going to happen? It is going to increase the peristalsis. Contraction will be there. Peristalsis. right? What happens to bladder? Bladder will contract or relax? Contract. You will be having what? Bladder contraction will lead to what? Urination, right? And ultimately bowel will be contracted, right? So you will be having defecation, right? You understand some people are smoking in the morning. They can't able to go, right? What is the thing? What is the things that these symptoms are going to be working? These things are going to be working there, right? What happens to your heart? Your heart will be having SA node and AV node. What happens when SA node will be decreased? Voice is okay now? Because of mic it's going. Maybe we need to decrease the load. Let me see. Please give us a confirmation. Okay, we can use another one. Right. Maybe you are able to hear like this. Yes, sir. I think this audio is coming from outside. Maybe you can change the. Just give me a moment. Is it
Is
fine
it
now?
fine now?
Yes, yes, sir. Audio is
Audio is
okay.
okay.
Phone is
Phone is
working.
working.
Right? Is it okay?
Thanks.
Better now?
And now we can keep note. Once we'll check.
Double audio.
Oh.
Is it okay now?
So,
Better?
sir.
This phone is having the noise cancellation, right? All right. All right, guys. So what is going to happen here? As compared to the topic we are having, right? So we are going to have what cholinergic nervous system. This cholinergic will be having these receptors. These are the receptors we are having, right? Once you remember these receptor, you need not to mug up anything. Second, we are having M2 and M4. Whenever is there activation of this M2 receptor, what is going to happen? This M2 will be GI-G0 type of subunit, right? What is the function of SA node? SA node is going to increase contraction or decrease the contraction? Decrease. SA node will be, SA node function is to do the contraction, right? Now what we are doing, we are blocking that SA node because it is what type of subunit? GI G0. So it is going to decrease the heart rate and it is going to decrease the AV node is concerned with what?
Contraction, but now it will decrease.
Not contraction. Dekho, let's try to understand this. I'm just making a rough small diagram. Concepts should be clear. If concepts are clear, we are going to make better basics, right? Better understanding. So this is going to be your heart. Heart will be having only three things. This is going to be SA node. This is going to be AV node. And here you will be having what, Bida? This is muscles. Muscles will be there. So you are having only three things in heart. First thing is SA node. And always remember, SA node is always concerned with heart rate. SA node is always concerned with heart rate. AV node is always concerned with conduction. SA node is always concerned, AV node is always concerned with conduction. Conduction means the current will from this above chamber will be going to below chamber. This particular thing is known as conduction. And what is the function of AV node? Is the function to transmit the current from above chamber to below chamber. So from now onwards till the end of your life, AV node is always concerned with what? Conduction, not contraction, right? And function of contraction is the function of muscle. So these muscles are going to do what? Contraction. Muscles will be there and these muscles are going to do what? Contraction. So three things clear. Heart will be having how many things? We are doing revisions. How many things we will be having in the heart? Speak. Three things. Three things will be there. What is the first thing? SA node. Second thing. Third thing. Muscle. SA node will be contracted. What is going to happen? What is going to change? Heart rate, conduction, contraction. Heart rate. AV node, whenever I will talk about AV node, I will talk about conduction. Whenever I will talk about muscle, I will always talk about contraction, right? So AV node will be decreased. What is going to happen? Conduction will be decreased. Conduction will be decreased. You understand these things, right? So what is the function? This is going to be the function. Now you can apply it anywhere. You know about any disease that you understand, right? Like you are having organophosphate poisoning, you study in pharmacology. What is the symptom organophosphate poisoning? It is a type of parasympathetic or a sympathetic type of poisoning. Parasympathetic cholinergic poisoning. Organophosphate is a cholinergic poison. What happens to the patient? You know the receptors, you know everything. What happens to patient? Look here. First thing, what happens to his CNS? Increase in cognition. What happens to his GIT? Increase in acid. No need to understand this. What happens to pupil? Meiosis. What they will write you in exam? Pinpoint pupil, meiosis. Pinpoint pupil, meiosis. What happens to their salivary gland? Salivation will be there. What happens to their bronchus? Bronchoconstriction. They are not able to breathe, right? What happens to their GIT? Increase in peristalsis. Okay. Bladder will be having urination. Bowel will be having defecation. What happens to the heart? Heart rate will be decreased. Conduction will be decreased. Just try to understand this. This is not just a theory. This type of patients are going to come. So when a patient is going to come on a stretcher, what you are going to see and how you are going to understand? Okay, patient is coming on the stretcher. You look at the eyes of the patient. There will be pinpoint pupil. What other things you can understand? This patient will be having salivation. Drooling of saliva will be there. This patient has more peristalsis, and this patient has contraction of bladder. So this patient will be having dirty clothes. This patient will be having urination. This patient will be having, might be having defecation. And all of these things, is this patient is going to die? Yes or no? This patient will be having bronchoconstriction. That is why this patient is not able to breathe well. Okay. But are these things going to make the patient die? No. Why this patient is going to die? Because of decrease in the heart rate. Heart rate decrease means bradycardia or tachycardia? Bradycardia. So here you will be having first thing bradycardia, and second thing decrease in conduction. That means current from the above chamber is not able to come to below chamber. Okay, current from above chamber from the atrias is not able to come to the ventricles. Do you think ventricles will contract? Without current, sir, how they will contract? If they will not contract, what will happen to the patient? He will die. Right? So here, what is going to happen in organophosphate poisoning? You will be having bradycardia, and this conduction, decreased conduction is also known as what? This is also known as heart block. This is also known as cardiac block. You understand? Heart block means what? Current from above chamber is not able to come to below chamber. This is known as heart block. So this is what is going to happen in the first patient. That is going to be the OPC poison. Right? What is the drug of choice for OPC poisoning? Atropine. So atropine is going to be coming where? Whatever things are working opposite to that, these are going to be anticholinergic. I'm just giving you a quick explanation so that you can connect physiology with that also. Whatever is working opposite to this, now we can write this one also. Whatever is working opposite to this is going to be what? This is going to be anticholinergic, right? You are having increase in cognition, everything. Cognition means what? Cognition means what? You understand what is cognition? Cognition means basically a type of your consciousness, right? I am able to filter my thoughts. I'm telling you what I want to tell you. That means my cognition is intact. You have seen like movies. In movies, what they will do, they will bring the patient, है ना? They will bring a terrorist, let's say, and in that particular terrorist, they will inject something. And now what will happen? This terrorist will start to tell everything that he knows the truth, right? So this is going to be the meaning of cognition. That means we are going to decrease the cognition of that person, right? How we can decrease? Like one more example we can discuss, that is also like Dhatura poisoning. What is the drug of choice for Dhatura poisoning? Physostigmine. What happens in Dhatura poisoning? Dhatura poisoning, what is going to happen? Everything is in front of you. You remember this, you remember both the system. Okay. If you remember normal physiology, need not to mug up about anything, right? What happens in Dhatura poisoning? Dhatura is an anticholinergic type of thing. So what happens to cognition of the person?
let me just correlate this thing with the real life example that you are having. When you are traveling outside, what your family will say is, don't eat anything. If someone will give you sweets or something, don't eat. Why? Because FMT question, what is the most common roadside poison? Datura. Datura is also known as thorn apple. Image is also asked in your examination, right? So this is the most common roadside poison. It will be having seeds will be there, right? Inside will be seeds. So what this people, thief and those robbery doing people, what they will do, they will crush the seeds of the datura, and datura will be having anticholinergic thing. So they will crush the seeds and then they will mix with the water and they will give you the sweets. Now we are eating the sweets. They will say like, this is from the god, right? We went to temple and like that they will give you, and now you will be like, okay, fine. Now what is going to happen to you? Your cognition will be decreased. First thing, your cognition will be decreased because it is a anticholinergic thing. The thief will ask you, where is the money? And you will be telling, where is the money? You understand? You eat the sweet, and what is happening to you? Your cognition will be decreased. And he will ask you the question, and you will be replying. This is what is the anticholinergic, first thing. Second thing, acid will be decreased or increased? Decreased. What will happen to your eyes? Mydriasis. Whenever you are having mydriasis, you went for like you have specs, right? You go for checkup. What they will do? They will put atropine or topicamide, right? What will happen because of that? You will be having mydriasis. Are you able to see for 1 hour? No, you are not able to see clearly. You cannot drive a bike, right? And that is what is going to happen here also. This patient is able to see the thief or not? He will be having the mydriasis. So he is not able to identify what is happening, right? He will be having the mydriasis, right? Next thing, what will happen to salivary gland? Decrease in salivation will be there, right? What happens to bronchus? Bronchodilation. What happens to peristalsis? Decrease in peristalsis. Okay, decreased peristalsis will be there, or maybe constipation you can call, right? Decrease in urination, that means urine retention will be there. Uh, Urination will be decreased. Okay, decrease in defecation, that is also going to be what? Constipation, right? These things will be there. Well, apart from that, what happens in this particular M2, M4? What happens here? Here you will be having increase in the heart rate. Here you will be having increase in the conduction. So here you will be having about two important things. First is going to be tachycardia. Second is going to be increase in the heart conduction. Means current will be going more. And you know this particular thing, current will be going more here in anticholinergic poisoning, right? And we are having one more disease where current is going low and heart rate is low. Can you treat this thing with this particular thing? Yes or no? So all the things that you study, like studying atropine, datura, right? Belladonna, atropine, datura, belladonna, all these things are going to be what? They are going to be anticholinergic. They are going to be anticholinergic. And in fact, this atropine is the drug of choice for what? OPC poisoning. OPC poisoning. What happens in OPC poisoning? Bradycardia with AV block. What we are doing? We are giving atropine to the patient, atropine to tachycardia with increase in conduction. That is why the drug of choice is going to be what? Atropine, right? You understand this? Okay. So what is the thing you have to remember? Now remember, okay, this is the last time, this is the revision time. We are not discussing in detail, but I cannot leave you like that. You need to understand the topics also. Okay, if you don't know, you can ask me. Okay, so what is the thing we are having? We are having parasympathetic nervous system. Parasympathetic means what? Remember here itself. You know how you can remember? Only one way. You can speak with me. Okay, you can speak with me. You will remember. I'm going to ask you. You have to speak. Right. So autonomic nervous system. How many parts? Cholinergic and adrenergic. Cholinergic is also known as parasympathetic. Adrenergic is also known as sympathetic. What are the receptors for this cholinergic nervous system? What is the neurotransmitter? Acetylcholine. Acetylcholine, right? What are the receptor? Muscarinic and nicotinic. Muscarinic and nicotinic. These are the five muscarinic receptor. How you will remember? M1, M3, M5, M2, M4. M1, M3, M5, M2, M4. M1 is going to be present where? CNS and GIT. M3, pupil. Then everyone see here, pupil. Then salivary gland. Then bronchus. Then GIT. Then bladder. Then bowel. Right? This is going to be M3. M5 is going to be CNS and it is going to have not much importance. M2 is present at how many places? Two places. Two places. M2 is going to be present at two places in your heart. That is going to be SA node and AV node. SA node and AV node. Okay. And what is going to be the function? Here it will be GQ subunit. Oh, sorry, GIG0 subunit. Here it will be GQ subunit. Here it will be GQ subunit, right? Is that okay? No issues with this? Whatever things are going to be here, these are going to be cholinergic things. Whatever things are going to be here, these are going to be anticholinergic things. No need to mug up anything, right? You have multiple diseases. You have studied in pharmacology. You can correlate here, right? If a patient, we want to do surgery, like if a patient, we want to do surgery, before surgery, we want to do anesthesia. Before anesthesia, we want to intubate the patient. Okay. What is the drug would you like to administer in this patient before intubation so that he will not aspirate saliva? Anticholinergic. Name of the drug is glycopyrrolate. Glycopyrrolate is an anticholinergic drug. It is going to do what? Decrease in salivation. Another patient is going to come to you with the problem of xerostomia. What you want to do? You want to give something. Sjogren syndrome, xerostomia. What you want to do? You want to increase salivation. Xerostomia means dryness in the mouth. You give cholinergic drug to this patient, right? You are having another patient coming. She is coming to you. Okay, sir, I am having stomach pain. I am having periods, and because of that, she is having the pain. Right? Periods pain means there is increase in peristalsis or decrease in peristalsis. Increase in peristalsis. What do you want to do? Decrease in the peristalsis. You give what? You give dicyclomine to the patient. You give meftal to the patient. This is going to be what? Decreasing in the peristalsis, right? This is the normal functioning I'm teaching. You know about the drugs. All things will be working here itself. Patient is coming with hyperacidemia, hyperacid, right? What you can do? You can decrease the acid, give anticholinergic. Okay. M1 blocker drugs. What are the M1 blocker drugs? Pyrinzapine, telinzapine. In GIT you have studied, right? All these drugs, all the drugs that you study. Okay. Everything will be working here itself. You understand this? Yes or no? Okay. This is going to be the parasympathetic nervous system. What are the receptor? You understand the function, you can easily correlate, right? Only thing you have to remember from pharmacology is the classification of drug, which is cholinergic, which is anticholinergic, right? Next thing we are having is, this was your sympathetic thing. Next thing we are having is, this was your parasympathetic. Next thing is sympathetic. What happens in sympathetic? Sympathetic will be having what? It will be having alpha and beta receptor. Alpha receptor, you can remember alpha 1, alpha 2, beta receptor, beta 1, beta 2, beta 3. Right? So alpha 1, what is the function of alpha 1? It is going to cause what? Vasoconstriction. It is going to majorly cause what? Vasoconstriction, right? And vasoconstriction will lead to increase in BP or decrease in BP. Okay. So we are having 5 liters of blood. Let's say we are having 5 liter of blood. And what is BP? BP is pressure exerted by this blood on the wall of the vessel. What is BP? Blood pressure is what? The pressure exerted by this blood on the wall of the vessel. This is known as BP. Now you can tell me if this wall, if this vessel is like this and this vessel is like this only, right? There are two vessels. One is going to be dilated. One is going to be constricted. Where you will be having more BP. This one is dilated. Vasodilation will be having more BP or vasoconstriction will be having more BP. The blood in the body remains same, right? You understand? Blood in the body will remain same. So where you will be having more BP, so vasoconstriction will lead to increase in BP. Okay. Whenever you want to increase the BP, you do what? Vasoconstriction. Vasodilation will lead to decrease in BP. That is why we always give what in the cardiac, we are having myocardial infarction. Okay. Coronary artery block. We give a drug, nitric oxide. Okay. Nitroglycerin and all. This is going to do what? This is going to dilate the vessel. This is going to decrease the BP. Right? You understand this? Alpha 2 will be acting as a brake. Beta 1 will be present at how many places? Beta 1 at two places. One is going to be your heart. Second one is going to be your kidney. Second one is going to be your kidney. This is going to be your heart. And in your heart, how many things I have told you? Total things in your heart? 3. SA node, AV node, muscles. Muscles will be there. What is the function of SA node? increase the heart. It is a GQ type of subunit. You can think like that. Okay. So it is going to increase the heart rate. It is going to increase the conduction. It is going to increase the contraction also. It is going to increase the contraction also, right? In the kidney, it will be doing what? In the kidney, it will be releasing renin. It will be releasing renin, and the function of renin is to do what? Vasoconstriction, and vasoconstriction will lead to increase in the BP, yes or no? Vasoconstriction will lead to increase in the BP. Okay. So tell me, what are the beta 1 receptor are present at how many places? Beta se yaad rakho, beta will be 2, right? A and B. B will be 2. So what are the 2 places? One is going to be heart. Second one is going to be kidney. In heart, how many things we are having? SA node, AV node, muscles. In kidney, we are having what? Renin. Renin will lead to increase in BP. Okay. Beta 2 will be present. Beta 2 will be GS type of subunit. Now you remember what is GS. What this GS will do in the smooth muscle, it is going to do what? So it will be doing what? Bronchodilation. Beta 2 agonist you study in pharmacology, salbutamol and all those drugs, right? And second thing, salbutamol will be having 2 side effects. In a skeletal muscle, it is going to do what? Contraction. In cardiac muscle, it is also going to do what? Contraction. So skeletal muscle contraction is known as what? You have skeletal muscle contraction. Abnormal contraction of skeletal muscle is known as tremors, and abnormal contraction of cardiac muscle is known as palpitation. You understand what is tremor, what is palpitation? Tremors is abnormal contraction of skeletal muscle. Abnormal contraction of cardiac muscle is known as palpitation. Is that okay? No issues with this, right? Done. Right. Third, beta 3 will be first present on the bladder, and it will be also present on the fat cells of your body. Okay, adipocytes will be having, and here you will be having one enzyme working. This is going to be the hormone sensitive lipase, and this is going to cause what? Adipolysis. This is going to cause what? Adipolysis, right? So this is going to be your which system? Sympathetic nervous system. Neurotransmitter will be adrenaline or noradrenaline or dopamine. Adrenaline, noradrenaline or dopamine. Okay. It is going to increase the urination, right? We can give certain drugs here. We are having drugs like mirabegron we are giving for the beta 3 functioning, right? And second thing, this hormone sensitive lipase will be activated. Lipase means what? Lipid ko todega. It is going to break the lipid. Lipase is going to break the lipid, and it is going to do what? Adipolysis, right? Let me just try to connect if you can understand. You guys are understanding? Yes. So we are drinking what? Like we are drinking black coffee. Anyone going to gym? Right? Those people who are going to gym, they are drinking what? Black coffee. Why? Because black coffee is going to make what? It is going to make the precursor of all those things. What is the precursor of all those things? This is going to be tyrosine. This is going to be the tyrosine, and this tyrosine is going to activate your which system? Sympathetic nervous system. And what is the function of sympathetic nervous system? It is going to first thing increase the BP. Second thing, it is going to increase the heart rate. Third thing, it is going to increase the conduction. It is going to increase the contraction. It is going to increase ultimately BP and bronchodilation so that you can have better air entry. And ultimately, you are having beta 3 agonist function, which is going to do what? Adipolysis. That will increase the urination. Basically, when you go to gym, just try to understand you are drinking what? Anytime you are having this particular thing. Let me give you one more example. Let's say we are sitting here. Everyone is sitting in the parasympathetic mode right now. So just suppose we are having a earthquake or fire or something like that, okay? Or some kind of attack is happening. What will happen? Our sympathetic nervous system will get activated, yes or no? Fight or flight system. What will happen to your body? Just try to correlate things. Okay, we are not going to just solve the questions. We are going to treat the patients also, and how you can treat the patient when you can correlate the things. Okay, so what is going to happen in your body? Alpha 1 will be activated, leading to increase in the BP. Your BP will be increased, first thing. Second thing, in your heart rate, what will happen? Heart rate will be increased. Can you appreciate heart rate? Your contact conduction will be increased, your contraction will be increased, yes or no? You will be having palpitation, yes or no? A tiger or a dog is running behind you, what will happen? Suppose think like that, a dog is running behind you, you are running. Why you are running? You will be requiring what? While you are running, you will be requiring increase in the BP. Second thing, it is also going to cause what? It is going to cause mydriasis. It is also going to cause mydriasis. Okay, and it is also going to do contraction of prostatic urethra. That is what you are studying in the pharmacology, but I just want to give you the basic understanding, right? So what is going to happen when you are running? You will be having increased heart rate, increased conduction, increased contraction, increase in BP. Overall, this particular system is doing what? Increasing the BP. BP means what? Blood pressure will be increased. Blood pressure increased means what? What is blood? Blood is the connective tissue. Blood is the connective tissue. You tell me the function of blood. We are correlating things now, right? Are you understanding? What is the function of blood? Function of blood is to transport sub. Blood is a connective tissue, so it will be transporting RBCs. RBCs will be having hemoglobin. Hemoglobin will be transporting oxygen, and oxygen is required for what? You study biochemistry. Oxygen is required for aerobic glycolysis. Aerobic glycolysis means it will be required for production of energy, and that energy will be used by the muscles to run, right? You understand how these things are working very beautifully, right? So this thing is going to happen. We want what? We want increase in BP. Whenever increase in BP, you will be having functioning more energy production, and you require more energy so that you can run for a longer period of time. You understand this? Second thing, what is going to happen? This beta 2 will be activated, and this beta 2 is going to do what? Bronchodilation. Now you have the energy. Now you have the blood flow, but you require what? Oxygen also, right? And that is why you are having, like, after running for such a distance, what will happen? You will be having the bronchus will be dilated. Think about it. A dog is running behind you. You will be having what? When you stop, you will be having palpitation. You will be having high heart rate. You will be having dry mouth. Why this dry mouth? Because the bronchus is dilated. You are inhaling lots and lots of oxygen. Lots and lots of oxygen you are inhaling, and that is why you will be having this dry mouth kind of situation, right? And if you run for such a long distance, you know what is going to happen? You can have what? Adipolysis. That is what we are doing in the form of exercise, right? Adipolysis means we are going to break down the fat cells. That is why we are running, right? And that is why we are taking what? All those fat cutter drinks. I give you example of coffee, right? Coffee is having caffeine. Caffeine is going to increase your brain power. It is going to increase the tyrosine in the body. All fat cutter drinks are also going to do the same thing. Okay, you study about, if you know this concept, you can utilize it anywhere, right? Like we are having a thing, uh, just let me connect with a real life example. Like you are having uncle is sitting, and he got a news that his daughter is running away with some other boy, right? And she gets married. Now what is going to happen? What you see in movies? In movies, he will put his fist on the chest, and he will be going like that, right? Why this thing is happening? Why this thing is happening? After hearing a bad news, you always say don't give him any bad news, right? So what is going to happen after hearing a bad news? Which system will get activated? Sympathetic nervous system. Suppose there is already a atherosclerotic. Athero means artery. Sclerosis means hardening. Suppose there was already a atherosclerotic plaque which was there, right? Now what is going to happen? He's going to have this news, and this news will cause what? Vasoconstriction, vasodilation. Vasoconstriction, and he will be having vasoconstriction, and this vasoconstriction will lead to what? Decrease in the oxygen supply to the heart, and decrease in oxygen supply will lead to what? Two outcomes: decrease oxygen supply. Two things can happen. One is you call angina. Second, you call is myocardial infarction, also known as heart attack. Two things can happen, right? So what is going to happen? This decrease in oxygen can be reversible, for sometimes transient, okay, or it can be permanent, right? What is the most common cause for cell injury? Pathology done. Most common cause for cell injury, hypoxia. Most common cause for cell injury is hypoxia, and most common cause of hypoxia is ischemia. So what is ischemia? You have all the knowledge. You just need to apply it. You know everything, right? So what? Yes. So what is hypoxia? Most common cause for cell injury. If there is no oxygen, this cell will be having mitochondria. This mitochondria is not going to make any energy. This cell will be dying. This is known as hypoxia is going to lead to cell injury. Why there is hypoxia? Because of ischemia. Ischemia means emia. Emia means blood. Decrease in the blood. If there is decrease in the blood supply, how you will get oxygen? And you will not get oxygen, what will happen? Cell injury. And cell is the basic structural and functional unit of body. Your cardiac cells are going to die. You will be having two outcomes. You can have either reversible cell injury, you can have irreversible cell injury. Reversible is known as angina, and irreversible is known as myocardial infarction. You talk about infarction. Infarction means what? Necrosis, basically a type of necrosis, right? Oxygen is not reaching to the heart. You will be having death of the heart tissue. You understand? Everything will be simple. Just need to develop the understanding once. Once you have the understanding, now no need to mug up this thing, right? Now you know this thing, it will be easily you can treat this particular situation. What is happening, sir? This is just like a pipeline which is having some clot. Okay. Now what you need to do? Primary treatments is to dilate this vessel, give this patient nitroglycerin or isosorbate dinitrate, whatever drugs you are having, which is going to cause vasodilation. You give this first thing. Second thing, you are having the clot. You can remove the clot. If you are having cath lab, you can go inside. This is known as percutaneous intervention. You go inside, you put a stent over here. You put a stent over here. This is what we are doing. Someone is having attack, he is admitted to hospital. Now he is having what? Stenting. Now he is having stenting. Either stenting, or maybe if more vessels are blocked, we can go for bypass. We can do the bypass surgery, right? That is what is we are doing, right? So we are just removing. And if you are going to like primary healthcare center where you do not have all those things, like cath lab is not there, cardiologist is not there, what you can do? You can do the mechanical, or you can give the chemical things. You can use what? Thrombolysis you can do. You can use the drugs like streptokinase. Streptokinase is available. You can also use in the theoretical knowledge. You can also use recombinant thrombolytics, recombinant drugs, reteplase. You can also use reteplase or alteplase. You can also use reteplase or alteplase like drugs. Okay, this beta 3 is going to be present in the beta 3 is going to be present in the cells, and this is going to be activated by hormone sensitive lipase. Hormone sensitive lipase is going to do what? It is going to break down the lipid. So whatever lipid cells you are having, lipid is going to be what? Lipid is a what is the composition of lipid? Lipid is fatty acid plus, let me just give it from the basics. Okay. Long chain of triglyceride is known as what? You are eating dosa. What will happen with the dosa? There will be digestion, there will be absorption. That is what you study in physiology. Dosa is going to make what? Glucose ultimately, and that glucose will come into blood. This is known as absorption. Now your blood will be having that glucose, and this glucose will be making a long chain. This is known as what? Three glucose will be there. This is known as triglyceride, right? This triglyceride, long chain of triglyceride is known as what? Fatty acid. Long chain of triglyceride is fatty acid. When this fatty acid is going to bind with the alcohol group, right? Alcoholic group means OH, right? So then when this fatty acid is going to bind with OH, this is known as what? This is known as lipid. Now this lipid can be bind with the, this lipid can bind with glucose, this lipid can bind with phosphate, it will become what? Glycolipid, it will become what? Phospholipid. This is what you are studying, right? Basic should be sound, right? So this is going to be the thing. Now what is going to happen? We are having what? This lipase enzyme will be there, and this lipase is going to do what? Breakdown of the stored lipid, right? Whatever stored lipid you are having, fat cells you are having, they are going to come into systemic circulation. And when you do the exercise, you are taking black coffee, you will be activating this system, you will be having this adipolysis. And now when you are running, now when you are doing high intensity interval training, or you are doing sprinting, what will happen? That cells which are coming into circulation, they are going to break down into glucose, and they will be utilized in the form of energy. That is what we are doing. Okay, right? So this particular thing will be there. Parasympathetic, we have done. What are the receptor? Muscarinic, nicotinic. Sympathetic nervous system, what are the receptor? Alpha, beta. Alpha will be alpha 1, alpha 2. Beta will be functions. Alpha 1 will be doing what? Alpha 2, pray. Beta 1 at how many places? Heart and kidney. Doing what? Heart at how many places? Three places. This is going to be what and what? S node, AV node, muscles. S node, AV node, and muscles. And in the kidney, renin will increase the BP, right? Beta 3 will be doing what? Bladder will be having this adipolysis is the most important thing, right? Now, now you tell me, if a patient is going to come to you now, let me just apply it if you can understand this. Okay, then we will move forward. If a patient is going to come to you with cardiac arrest, you know the difference between all these things? Yes or no? Heart failure, cardiac arrest, myocardial infarction, okay, angina, all these things. You know the difference? What is cardiac arrest? What is heart failure? What is heart block? What is angina? What is myocardial infarction? You tell me. What is heart attack? All these things are same or different? Same. If you pass exam with the same, with the understanding all these things are same, then we are going to do, like if we are going to give treatment of cardiac arrest into heart failure, patient will be dying. And this patient is, it's not a mistake, it's a murder. You understand? It's not a mistake, it's a murder, right? So you should be having a sound knowledge before entering into the field, right? You are going to deal with the not with the machines, with the patients, right? So first thing is cardiac arrest. Arrest means what is going to happen? Sudden collapse of heart, sudden stoppage of heart. Now, if you have sound concept, you can utilize. Now, patient is having sudden stoppage of heart. Patient is what kind of case or how you will see on the streets also. Uncle is walking on the street and suddenly he collapsed and now this patient is having no working of the heart. Heart is not working. You check for the pulse. Pulse is not working, right? You check for the carotid pulse. Pulse is the representation of heart. You check for radial pulse. Your radial pulse is fine. That means your heart is fine. Pulse is what? Representation of heart. You check for carotid pulse here. Carotid pulse is not there. That means what is happening? Patient is not there, right? Second thing, you check for breathing. Breathing is also not there. What is the treatment would you like to give in this case? First thing you will be doing, cardio means heart, pulmonary means lungs, and resuscitation means you will be resuscitating that patient. So CPR should be given in which patient? Those patients who are heart is not working, whose heart is not working, whose lungs are not working, right? People are giving CPR to those people who are even speaking, right? You have seen the videos, right? So that is going to be the wrong thing. First thing is going to be what? If heart is not working, how you will understand? You check for carotid pulse. You know the carotid pulse, sternocleidomastoid muscle. Let medial to that, you will be identifying the carotid pulse. If you are having carotid pulse, fine. Okay. Second thing, you will be checking for the rise of the chest. If chest rises there, that means he is breathing, right? So both things are absent, you give CPR. If CPR is not effective, then you give the drugs. What is the drug would you like to give? Drug of choice for cardiac arrest? Don't muck up, okay? You know, adrenaline. Why? Sir, heart is stopped. Now you see the functioning. Alpha 1 is going to do what in this patient? BP will be raised. Alpha 2, break, let it be. Beta 1, sir, it is going to activate your heart. Yes or no? SA node will restart. AV node will restart. Muscles will restart, isn't it? Right? It will increase the BP. BP means blood flow in the body, right? It will activate your bronchodilation so that what will go into the lungs? Oxygen will go into the lungs, right? It will activate your bronchodilation. Beta 3 not so significant here. That is why the drug of choice in this particular cardiac arrest is going to be what? Adrenaline. You understand, right? If the patient is not, if you are not even having the adrenaline, what else you can do as a good doctor? You should have the knowledge, right? You should not treat the symptom. You should not treat the reports. You should have that knowledge, right? What else you know about this particular thing? What else you know? What else drug you can give to this patient? From this diagram, from this particular thing, patient is having cardiac arrest. You can give what? Atropine. You can add on what? Atropine. Why? Because atropine is also doing at least two things, right? So we can sometimes we are doing what? Adrenaline plus atropine we are giving. Isn't it? You understand this? Okay. You can do this, right? Heart failure, you can understand failure is not permanent. Failure is not permanent. If you fail, that means we are not dying, right? So failure, what is going to happen? The heart is like a motor. Functioning of heart is to pump the blood. Blood is a connective tissue which will transport the substances. So here you will be having what? Motor failure. If motor failure is there, do you think this patient is going to die? No. What is the treatment? We just want to increase the contractile power. Motor क्या करना है? Motor increase कर दो. You will increase the power of the motor. Now 1.5 horse ka motor laga do, right? That is going to be the thing, right? So you will increase the power, you will increase the contractility, you can give the drugs you study in CHF. What are the drugs you can give? What are the drugs you have studied in cardiology CHF chapter that you can use, right? You can give digoxin, you can give dobutamine, you can give isoprenaline, depending on the symptoms, right? That is going to be the heart failure. Heart failure means heart is not pumping effectively. We can have, like you have studied about two-sided, two side will be there, right side heart failure, left side heart failure. Left side heart failure, patient will be having what? Accumulation of blood coming into the lungs, patient will be having dyspnea. We can have right and left sided of heart failure, you will study in pharma, right? Next thing is about the heart block. Heart block means what? Conduction block. Now current is not able to come from above chamber to below chamber. This is going to be the heart block. Here drug of choice will be what? Atropine. So bradycardia, you can remember bradycardia with heart block, drug of choice will be what? Heart block. Drug of choice will be atropine. Drug of choice will be atropine, isn't it? Right? So that we can have this current below going below, and this is going to be the heart block, cardiac block, also known as AV block. AV block, heart block, cardiac block. We are having, like you study in medicine, Mobitz type 1, Mobitz type 2. This is what is heart block. Angina means it's a temporary, there is going to be temporary blockage in the artery because coronary artery, and this is going to decrease the supply in the heart. You will be having pain for some time. This is going to be angina, right? If you are not treating that angina, it is going to cause what? This is a temporary thing. It is not, it is going to cause what now? It is going to cause the damage, and this damage part is going to be what? This is known as myocardial infarction. This is known as myocardial infarction. And remember, myocardial infarction and heart attack are the same thing. They are the same thing. Clear? Eh? No issues with this. Everything is okay, right? These are the simple things. Once I tell you, you will understand. But if you will not understand, this is going, if you will not read this particular thing and go to hospital, this is going to be the problem, right? Is that okay? Right? For the treatment, you will understand, but basics should be there with you, right? So this is about the sympathetic thing, right? So we are done with the basics. Now we are going to discuss about the structure of a cell. How a cell is going to look like, right? What are the different things we are having in the cell? Sympathetic, parasympathetic, basics are done. Doable, right? Now we are going to discuss about the structure of a cell. Cell will be having what? Mitochondria. Cell will be having plasma membrane. Do we have plasma membrane? Do we have cell wall? Cell wall is there, right? So what is the thing we are having? Yes or no? Yes or no? Yeah, it's not like that. Yes, sir. If I'm wrong, I'm wrong, right? Yes or no? Very good. Cell membrane is there. Cell wall is a feature of bacteria. Plants you need not to do. Plants you left in the 11th, 12th. Now you are a doctor. You have to think about bacteria only. What you have to do with the plants, right? But yes, plants are having, but the important thing is bacteria. Why bacteria is important? You study antibiotics. We are having a class of antibiotics. These are going to be cell wall synthesis inhibitor. What are the drugs you know that are coming under cell wall synthesis inhibitor? I'm doing correlation. Is that okay with you? Or should I go with the only physio? No, you understand this, right? So that double subjects revision will be there, right? So cell wall synthesis inhibitor will be what? Penicillin, cephalosporins, penicillin, your all the penicillin, all cephalosporins, all monobactam, all the drugs which are carbapenems, right? Like ferropenam, meropenam, all these drugs are all cell wall synthesis inhibitor, right? We humans do not have the cell wall. Humans do not have the cell wall, so they are not going to infect us. They are not going to affect us. So they are going to be safe in us, right? Bacteria do have cell walls, so bacteria will be killed with the help of these drugs. That is why you are using these drugs. They are going to be cell wall synthesis inhibitor. You understand this? First thing, cell wall is a feature of bacteria, right? Cell wall, humans do not have the cell wall, right? First thing. Second thing we are having is mitochondria. This mitochondria is responsible for what functioning? Powerhouse of the cell. I've also studied this thing in the 7th class, right? What else? No. Apart from powerhouse of the cell. You done with biochemistry? ATP production. That is why it is known as powerhouse of the cell. What else? What else function you can recall? Mitochondria. What is the reaction that is happening in the mitochondria? My story begins with the dosa today, right? I had dosa in the morning. So let's begin with the dosa. You had dosa, right? What will happen with the dosa? It will go to your mouth, it will go to your esophagus, it will go to your stomach, right? In the stomach, you will be having acid. It will be digested. What is the digestion? Breakdown of dosa into glucose, right? Whatever things you are eating, it will convert into glucose. 5 things you are eating. You are eating what? Carbohydrate, you are eating fats, you are eating proteins, macro and micronutrients. We are having classification: carbohydrates, fats, proteins, vitamins, and minerals. Story is over. Anything you are eating, be it vegetarian, be it non-vegetarian, any individual on the earth, right? He's eating 5 things. What are the 5 things? Carbohydrates, fats, proteins, minerals, and vitamins and dosa, right? These are the 5 things we are having, right? Some people are like, so dosa is a different food, right? So we are having these particular things, we are having these particular thing, right? All those things are going to be, all the carbohydrate is going to make what? Glucose. All the carbohydrate is going to make what? Glucose will be there. Now, this glucose will be having, this glucose will be going to the cytoplasm of the cell. It will go into the cell, right? It will go into the cytoplasm of the cell, and in the cytoplasm, what will happen to with the glucose? Glycolysis will be there. Glycolysis will be there. And after glycolysis, what is going to be the end product? Pyruvate, and this pyruvate can go into aerobic and anaerobic glycolysis. Whenever oxygen is not present, what it will make? It will make lactic acid. And if oxygen is present, it is going to make what? It is going to enter into which cycle? Krebs cycle, and then it will enter into TCA cycle, and then it will convert into H2O plus CO2. This is the end product of dosa that you are eating. You understand the complete chronology, how this thing is happening. This dosa you are eating, it will be going into the body. It will have digestion, it will have absorption, it will come into blood. After coming into blood, it will go into cell, right? In the cell, it will be having glycolysis. This glycolysis, site of glycolysis also you can understand, it will be in the cytoplasm, right? Site of glycolysis is cytoplasm. Then TCA cycle. Then which cycle will occur? Not this TCA. The scrap cycle or TCA is the same thing, right? Then which cycle will occur? This is going to be scrap cycle or TCA cycle, and then it will convert into ETC will be there, and after the end product of ETC is going to be what? H2O and CO2, and this will be coming out of the body. You understand? This is the complete chronology. Now, so what is the other function of this mitochondria? You can remember this mitochondria will be causing what? Beta oxidation of fats. It is going to do one more function, beta oxidation of fatty acid. It is going to do beta oxidation of fatty acid. It will be having function of apoptosis. It will be having function of TCA cycle. It will be function of ETC will be happening here itself, right? These are the questions they are asking from biochemistry. What is the site of glycolysis? What is the site of this TCA cycle? What is the end product of all those things, right? How many ATPs are formed, right? Second thing we are having is what, like apoptosis is also going to be there. So those cells which are having mitochondria, they are going to do what? Aerobic glycolysis. Those cells who do not have mitochondria, they are going to do what? Anaerobic glycolysis. ये बात समझ में आती है? This thing is clear to you. Okay. Second cell we are having, second organelle, this is going to be peroxisomes. What is the function of this peroxisomes? Peroxisomes has an enzyme. It is an enzyme which is going to break H2O2 into H2O plus O2, and this enzyme is known as catalase. It will be having an enzyme which is known as catalase. And now this oxygen is going to be converted into single oxygen molecule. And you can simply remember the single oxygen is going to be what? Peroxisomes is going to make single oxygen. What is the single oxygen is also known as? It is going to make free radical. What do you know about free radicals? Make us old very fast. Okay, so free radicals are responsible for the cell injury. First thing, free radicals are responsible for the aging also, And free radicals are like single molecule. What are these free radicals? Like oxygen is a couple. Two oxygen is good. But if oxygen is moving alone, it is a single. Whenever a single person, what single person will do? They will destroy the life of couples. Think like that. Okay. So what it will do, whenever this oxygen is going to come in contact with any couple, it will do what? It will do the damage over there. Why our body is making these free radicals? There are going to be certain infections which we cannot kill normally, right? To kill them, our body is making something. What our body is making? Our body is making these free radicals. So these free radicals, they are making to kill those organisms, right? And they are also known as what? They are also known as reactive oxygen species. They are also known as reactive oxygen species. Okay, so your body is having those and reactive oxygen species, and they will come in contact with your skin. You are having wrinkles, right? What? Why we are getting old? Why we are having wrinkles? Because those people who are eating more. There are two things about it, right? Those people who are eating more. Two things about aging. Why we are dying early? Why we are aging? Like you can see the examples, like Japanese people. Japanese people are eating very less food. Okay, Japanese people are eating very less food, right? And they are working more. That is the reason they are living more also, right? They are Japanese people you have seen 80, 90, 100 plus will be there, right? Second people that you will be finding very good looking skin and all, these are going to be European people, right? European people, they are drinking what? Red wine. And red wine will be having sirtuins, which is having antioxidant property. It's not like that they are drinking the complete bottle, right? They are drinking little bit amount of as a ritual, right? So that is going to be the thing. So these are the two things which are decreasing what? Free radical. And free radicals, and what we Indians are doing, we are increasing the free radicals. We are eating whatever comes in our way, right? So when we are eating more, we will be having more free radical, and more free radical will lead to more cell injury, and you will be having that particular early aging will be there. If you want to delay aging, first thing, eat antioxidant fruits with the antioxidant like vitamins, three vitamins antioxidant property. What are the three vitamins which are having antioxidant property? E, some people are putting EB on the face also, right? Can understand. You can correlate things. A will be there. This is going to be ACE. Vitamin A, vitamin C, vitamin E. They are having some kind of antioxidant property. So they are going to do what? Antioxidants we are eating. Antioxidants are going to kill those oxidative species. You understand? They are going to kill free radical. That is why it is advised to eat what? Fruits and all those things, which is having the antioxidant things. And this free radical injury will be reduced, and you will be having healthy glowing skin, right? You understand this? Tomorrow I'll teach about the skin, right? So this is going to be the free radical. These free radicals are formed where in the cell? Peroxisomes. Peroxisomes. We are having two paroxysmal disorder. Please to make a note somewhere, right? They are going to be Zellweger syndrome. And second, you have to remember is Refsum disease. You studied biochemistry about them. Refsum's disease and Zellweger syndrome. Zellweger syndrome and Refsum's disease are the two diseases that we can have because of this free radicals. But these are two paroxysmal disorders, right? What is the function of rough endoplasmic reticulum? It is going to do what? Protein synthesis. It is going to do what? Protein synthesis. याद करते जाओ साथ के साथ. Just try to speak along with me so that you can remember also. Okay. You are coming to this class. My purpose to make you understand things. And second thing is you will be remembering things now here itself, right? Here itself. So we are having centrosomes. Centrosomes are going to be what? These centrosomes are going to be there. They're responsible for cell division, and these microtubules are going to be there. They are going to be the cytoskeletal filament. I'll teach you all those cytoskeletal filament after this. Lysosome has a function. What is the function of lysosomes? It is having the function of autophagy, right? So it is going to engulf the cells. This is going to be the suicidal thing it is going to do. And what are the cells it is going to engulf? And how it is going to kill? This killing is going to be acid mediated. This killing is going to be acid mediated. It will be having parietal cells will be there, proton pump will be there, and that is going to produce what? Acid, and that HCl acid will be there, which is going to fill the cells, right? Next, we are having this chromatin. Chromatin is what? Condensed form of chromosomes. Condensed form of chromosomes. Nucleus will be having DNA storage for DNA. Smooth endoplasmic reticulum has three important functions. What are the three important functions? It is going to do what? Steroid hormone, lipid hormone, biosynthesis. Steroid hormone biosynthesis. Steroid hormone biosynthesis. Second thing, it is going to do the storage of calcium. Storage of calcium will be there. And third function, it is going to do what? Drug detoxification. It will be having CYP450 enzymes, which is going to do what? Drug detoxification. Golgi apparatus and Golgi vesicles are going to do what? Whatever proteins are made here in the ribosomes, these proteins are going to go where? Into the Golgi apparatus and vesicles, and they are going to do the packaging of those proteins. They are going to do the packaging of those proteins for the delivery, right? And whatever proteins which are not good, whatever proteins which are not good or misfolded proteins, they are going to be degraded. Yes, protein folding is done with the help of chaperones. Protein folding is done with the help of what is going to happen? This ribosomes, mRNA is going to make what? Proteins. This proteins folding is done with the help of chaperones, right? Chaperone has a function to do the protein folding. Now, sometimes you have misfolded proteins, wrongly made proteins. Body will also make mistakes, right? Those misfolded proteins should be killed in the body, and they are killed with endoplasmic reticulum associated degradation will be there. Okay, via which pathway? Ubiquitin proteasome pathway. Ubiquitin proteasome pathway that you study in biochemistry. So this pathway, you are going to kill those proteins. Misfolded proteins should not be there. This is the basic funda. If you are having those misfolded proteins, what are those misfolded proteins? What is the disease you can have? What is amyloid? Amyloid is a misfolded protein. So you can have amyloidosis. Do we have any treatment for that? No, you do not have, right? So that is the basic funda. Your body is a machinery. Your machines, what is the machine we are having? That is going to be cells, right? And cells are making what? They are having ribosomes. They are making what? Proteins. And this proteins folding is done with the help of protein folding is done with the help of protein folding is done with the help of chaperones, and misfolded proteins are going to be killed with the help of ERAD, right? And lastly, we are having what? Cytoplasm. So this is going to be the structure of cell. These are going to be the things we are having in the cell. The cell membrane is made up of which layer? Phospholipid bilayer. It is made up of phospholipid bilayer, right? Now, what are these cytoskeletal filament? What are these cytoskeletal filament? Let's try to understand. We are having three types of cytoskeletal filament. We are having microtubules. We are having intermediate filament. We are having microfilaments, right? Microtubules, intermediate filament, and microfilament, and they are divided on the basis of diameter. They are divided on the basis of diameter. We can have the diameter like 25 here, 7 here, and 10 here. Intermediate filament, you can remember, they are going to be static one. They are going to be static. They will not change their shape or size. Whereas both of them are going to be dynamic. Microfilament and microtubules. One is going to be tube, one is going to be filament. ऐसे याद रखो, how you can remember, tube is going to be bigger. Tube is going to be bigger. This tube is going to be bigger, right? So we are having this microtubules. What are the examples? First one is kinesin. Kinesin is responsible for what? It is responsible for forward axonal transport. It is responsible for forward axonal transport. Whereas dynein is responsible for reverse axonal transport. Dynein is responsible for reverse axonal transport. And tubulin is responsible for cell division. Cell division. What are these intermediate filaments? They are going to be static filament. So we are having what? Keratin, desmin, vimentin, okay, GFAP or lamin. So this keratin is responsible. Keratin will be more in the skin, right? So you can have anytime you can have cancer. What is going to happen? You will be having increase in these markers, right? They can be used as a marker. So keratin is a marker for skin cancer, and that is going to be keratin is a marker for any tumor which is epithelial in origin. This is going to be what? Epithelial tumor is carcinoma. Desmin is responsible for mesenchymal tumor. Okay, mesenchymal tumors are known as sarcoma. Like mesenchyme means muscle. You can write it there also. So you will be having when you have muscle or bones involvement in bones. What is happening? Osteocarcinoma or sarcoma? Osteocarcinoma or sarcoma? Sarcoma, right? So Tasmin is a marker for sarcoma. So muscle tissue or bone cancer is going to be what? Sarcomas, mesenchymal in origin, right? Vimentin is a marker for fibrosarcoma. It is a marker for fibrosarcoma. Whenever you have GFAP mutation, it is going to cause what? GFAP is a marker for astrocytoma. This is a glial fibrillary acidic protein. Glial fibrillary acidic protein, and it is a marker for astrocytoma. And this lemon mutation will lead to what? This lemon mutation will lead to a special disease that is known as progeria. Progeria, right? Yes, pro means fast. Pro means faster. Geria means geriatric, that means aging, right? You have seen a movie Pa movie. In Pa movie, Amitabh Bachchan has what? Yes, the progeria, right? He is having faster aging. This is due to lemmin mutation. And actin is going to be responsible for these contractile proteins. What are the contractile proteins we are having? This is going to be your actin, myosin. You study about the contraction, right? These are going to be the contractile proteins that we are having. Clear? These are the contractile proteins that we are having, right? If there is mutation of dynin, which disease is going to occur? Dynin mutation can lead to a disease. Dynin mutation or a ciliary defect. A syndrome is known as. Have you heard about this? Carter-Jenner syndrome, right? Carter-Jenner syndrome will be there. And here you will be having the thing that is going to be BDS. BDS is going to be what? B4. The triad will be, you will be having bronchiectasis, D4 dextrocardia, and S4 sinusitis. The function of cilia is to do the movement in the unidirectional. Unidirectional movement hota hai cilia mein, right? It is going to do the unidirectional movement. Now what is going to happen? Let's try to understand this. Right? Sinusitis means you will be having a mutation of this particular thing. If you are having ciliary mutation, you drive a bike, you come through a bike, what will happen? You will be having all those dust going into your nose. It will be going to your sinuses, right? And after sometimes, when you stop the bike, do you have coughing? Do you have sputum? You drive bike, scooty in our like streets. If we have pollution, if we have something, right, dust will be there. Those particles will automatically come out or not? Yes. Why they are coming out? Because of cilia. We are having cilia, and cilia has a function to do unidirectional movement. That means it is going to remove all the things in the same direction, not inside the body, outside the body, right? This is the basic functioning, right? Those people who are smoking, what will happen? They will be having early morning coughing, right? They will be having sputum. They will be having sputum because whatever they are inhaling, all those dust and dirty particles, they will be coming out from the bronchus, right? So that is known as the function of cilia. Now we can have what? Now whenever we have ciliary defect is going to be there. That is going to lead to problems. Ciliary defect means what? The cilias are not working. If the ciliars are not working, we will be having a symptom that is going to be a disease that is known as Carter-Jenner syndrome. What is the name of the disease? Carter-Jenner syndrome, where we will be having bronchiectasis, we will be having dextrocardia, we will be having sinusitis. Sinusitis means inflammation of the Sinuses. How many paranasal sinuses we are having? What are the sinuses you know? Ethmoidal. All of them are paranasal sinuses. Around the nose will be paranasal. What is para? Parathyroid means around the thyroid. Okay. So around the nose, paranasal sinuses. Sinuses means it is a hollow viscous cavity will be there, right? And the function of sinus is what? To humidify the air. Like you guys are living in a cold environment. You are living in Russia. What is going to happen? Lots of cold air will be going inside. If you have that cold air directly going into your lungs, -20, -50 degree, what will happen to your lungs? Right? Problems, right? So to decrease that, we are having what sinuses. So air will be going through all those sinuses. Humidification of the air will be there, and all those dirty particle entrapment will be there. You are going through a bike. What will happen? That much dust particle which are coming out that should be going to your lungs if the sinuses are not working well. Right? You can have sinusitis means inflammation of these sinuses. And remember, whenever in your body you are having what stasis. Stasis means any foreign body stasis means there will be no movement. It is going to do what? It is going to do colonization. It is going to do infection in the body. So what is going to happen in sinusitis? There will be no movement of cilia. Now dust particle will be staying there. You will be having bacteria will be coming. You will be having infection. And that is what is known as sinusitis, right? Dextrocardia, normally your heart is always made in the right side. Now it will turn and it will come into left side. Some people are having what dextrocardia. This is also known as sinus invertus, right? Sinus invertus, right? And what else? This patient can have infertility also. This patient might also have infertility. Why this infertility? You know, every month there will be rupture of ovary. Every month there will be rupture of ovary, and through ovary, what is going to come out? Ovum. And this ovum is taken up by what? This ovum is taken up by the fimbria. You will be having those fimbria. This tube is which tube? Fallopian tube. And where is going to be the site of fertilization? Ampulla. So this fimbria should be taking this ovum. Yes, sir. They are taking every month. But this movement, this fallopian tube movement of this ovum is via cilia. So that it will not go into the backward direction. It will always come into the forward direction. Now you have the ciliary defect, Carter-Jenner syndrome. Do you think this thing can go come to this ampulla? No. If ovum is not coming to ampulla, sperm is only coming to ampulla. Do you think this patient will be having pregnancy here? No, there will be no fertilization. Fertilization is sperm meeting with the ovum. There will be no fertilization. There will be no fertilization means there will be no pregnancy, right? No pregnancy. Even if this fertilization is happening somewhere here, this is going to cause what? Which pregnancy? Okay. Function. If you what we are discussing, normal functioning of the body. You understand all the diseases are going to come from here. They are you are discussing about what in obs gynae. This is the topic of obs gynae, right? Ectopic pregnancy, tubal pregnancy, what you will be doing. Basic understanding if you have, you need not to mug up anything, right? Apart from that, two more diseases I can conclude over here. This dynein is responsible for reverse axonal transport. What is the meaning of that axon? This is a neuron, this is a axon, and this is synapse. These are going to be cell body. This is known as axon. You understand? I'm drawing a neuron, dirty neuron in front of you. You can understand. Here you will be having those dendrites coming, right? So you understand? These are the dendrites. This is going to be a cell body, and this is known as axon, and this is going to be the synapse. And here you will be having another neuron, right? What is forward axonal transport means everything is going in this direction. This is forward axonal transport. That means from brain, every information is going below from the cell body to the synapse. This is forward axonal transport. What is reverse axonal transport? That means now the information is going in the backward direction, in the opposite direction. Two diseases are going to have this dynein mutation of reverse axonal transport. One is going to be your rabies. What is the causative agent of rabies? What is tetanus? Lissa virus is the causative agent. Very good. That is going to be for the rabies. Now you had a dog bite, and dog bite is on the leg, right? Now this virus will travel. This virus will come into your body, and this will travel all the way through your spinal cord. It will go to your nape of neck. It will go to your cerebellum. Cerebellum will be having what? Negri bodies. What are those negri bodies? These are the virus which is traveling through the leg to the brain. and you will be having all those symptoms, hydrophobia and like aerophobia. Why the symptoms are happening? Because you have the virus in the brain, and that brain will be having the functioning that when you drink water, you will be having the pain. So that virus is causing all those symptoms, right? And how this virus is traveling via reverse axonal transport, first thing, right? How you will be treating this particular thing, that is going to be the tetanus vaccines we are having. We do not have a particular treatment for both of them, right? Both of them can be 100% fatal diseases, and both of them are vaccine preventable also. So anytime you had a bite, definitely you should get the vaccination, right? Next thing we are having is about the tetanus. You are traveling on a road. Tetanus is due to which organism? Clostridium tetani is the bacteria. Clostridium tetani is the bacteria, spore forming bacteria. And these spores are present in the soil. You are driving a bike, you had an accident, you are having those soil coming in contact with your body. Soil coming in contact with your body, the spores coming in contact with your body. Spores are unfavorable form, and when they come in contact with the blood, they will get activated. Once they will get activated, what is going to happen? You will be having those Clostridium tetani bacteria in the blood. It will make two toxins, tetanolysin and tetanospasmin. This will go again. It will go back to your spinal cord, right? And in the spinal cord, it will inhibit what? Inhibitory neurotransmitter. It will go to your mouth also. It will inhibit your muscle. Which muscle? Medial pterygoid. And medial pterygoid inhibition will lead to trismus, also known as lockjaw. This disease is also known as lockjaw, right? And when it goes to your spinal cord, it will inhibit the inhibitory neurotransmitter, two inhibitory neurotransmitter, that is going to be your glycine and GABA. Okay, brake will be failed. There will be no inhibition. No inhibition means what will happen? There will be overactivation of the excitatory neurotransmitter, and that is what is going to produce what? Over contraction. You understand what will happen to this patient? This patient will be having a specific posture. Specific posture will be there, and this posture is known as opisthotonous posture. You understand? Have you seen about the opisthotonous posture? The patient will be like this, right? This patient will be having bow-like posturing. Okay, hands will be here. This body will rise, and here you will be having the legs again. And this is known as opisthotonous posture, right? Why this opisthotonous posture is happening is because of this over contraction. Why this over contractions are inhibitory neurotransmitters are inhibited. You understand this? No issues. Yes. So both of them are traveling via reverse axonal transport. This dynein is responsible for both the movements. Okay. Now comes the next part. This is going to be the ionic composition. What is the ionic composition? They are asking question. They are asking what is the most abundant cation, what is the most abundant anion in the body. They are asking simple question. Most abundant cation, most abundant anion in the body. This is going to be what? Cation means first thing, cation will be having T. That T is looking like a positive charge. So cation means a positive charge. Anion means a negative charge. We can have two things. We can have outside the cell. We can have inside the cell, extracellular, intracellular. Now you tell me extracellular cation will be coming somewhere around plus 140. What is the cation? If I ask you simple question, you see this cation is going to be positive, anion is going to be negative. This is your extracellular, this is your intracellular. These are your intracellular, these are your extracellular. Now the question they are asking, I'm asking you the same question. What is the most abundant extracellular cation? Most abundant extracellular cation. That means what is the more amount outside the cell? Most abundant extracellular cation, this is going to be sodium. Most abundant intracellular cation. That means sodium is always more outside, potassium is more inside. Most abundant extracellular anion. Anion will be chloride. Anion will be chloride. Most abundant intracellular anion. Phosphate, right? Phosphate. Potassium will be positive, right? So that is going to be the thing. These are the questions they are asking. I hope you will be able to solve this type of question. They have asked two questions from here. What is the most abundant extracellular cation? They will give you values. They will give you values like 140, 10, and calcium is 8, right? They will write you a question. This is a particular question. They will be writing you, we are doing some fluid analysis and we have find out that this particular cell is having Sodium 140 milliequivalent, potassium 10 milliequivalent, and calcium is going to be like 8 milliequivalent. What is the compartment we are talking about? So which compartment will be it? Sodium is more, that means they are talking about inside the cell or outside the cell? Outside the cell. Second question they give you, how they are asking question, I'm just giving you idea, right? So they are going to give you a question. The levels of potassium is 140, the levels of sodium will be low, the levels of magnesium will be okay. So now what is this particular compartment? This is going to be intracellular compartment, right? You understand the cellular compartments, right? Next thing we are discussing about the glut. We are having glut, we are having SGLT. We are having glut 1, 2, 3, 4, 5, and we are having SGLT. More gluts are going to be there, but what is important, that is what you need to remember. Okay, we are having SGLT 1 and 2, you have to remember. So glut 1 is going to be present where? BKP, that is going to be brain, kidney, and placenta. Glut 2, you have to remember, this is going to be present in the liver and pancreatic beta cells. Beta will be having 2, you can remember glut 2 will be there. Glut 4 will be present where? It is going to present in your heart, skeletal muscle, and adipocyte. Glut 4 will be present where? Speak. Heart, skeletal muscle, adipocytes. And they are going to have insulin stimulated glucose uptake. Just remember this point, I'll teach you in diabetes. Right? Glut 3 will be same, BKP. Right? Next thing we are having is glut 5. It is going to be present in the small intestine, and F for 5, F for fructose. It is concerned with what? It is concerned with the fructose. Glut 5 is generally responsible for what? It is responsible for the fructose thing, right? Lastly, we are having SGLT1. This is going to be your sodium glucose like transport, uptake transport, right? So it is responsible for, in the small intestine, it is responsible for the uptake of glucose. It is going to uptake the glucose, small intestine. And SGLT2, this is present in the PCT, proximal convoluted tubule, and it is going to absorb what? It is going to absorb glucose from the kidney. It is going to absorb glucose from the kidney. So whatever kidney will be releasing that glucose out, it will be reabsorbing that. Okay. Last thing we are going to discuss. I know you need a break. Okay. We will discuss this types of transport and then we will have a break. Right? You don't want break? We need, sir. I can understand. Or do you want a break before? Or just let's just finish this chapter and then we will have a break. Okay. So we are having this types of transport. This types of transport means how these things are going in and out of the cell, how these things are going in and out of the cells. So we can have two types of transport. We can have passive transport, we can have active transport. Okay, we can have passive transport, we can have active transport. One thing you already know by the term passive means, is it going to use any ATP energy? You guys are inhaling oxygen from the environment. Are you using some kind of energy? No, this is a free process, right? So this is going to be what? This is going to be the diffusion. So here we are having what? Passive transport. Passive transport will not utilize what? ATP. It will not utilize what? ATP, right? So we are having what? Diffusion will be there. And we are having simple diffusion and facilitated diffusion. This is very important. Simple diffusion and facilitated diffusion will be there. What is the thing we will be having in the facilitated diffusion? So there will be certain things which are going to help, right? We can have channel proteins, we can have carrier proteins. They are going to help. And two example you have to remember for facilitated diffusion. Okay, what are the two examples? One is going to be, second is glut. Glut and aquaporins are a type of facilitated diffusion. Glut and aquaporins are a type of facilitated diffusion. Facilitated diffusion. Whereas in the cases of this is going to work on the basis of a principle that known as fixed principle. It is going to work on the fixed law, right? FICKs. So here basically what is going to happen, we can have isotonic solution, hypertonic, hypotonic solution. Okay. And all these things are going to be working on the basis of osmosis. Anything will move from its higher concentration to lower concentration. In environment, we have more oxygen. In lungs, we have less oxygen. Oxygen will go from environment to our lungs. In blood vessel, you are having more oxygen. Like same thing will happen. Environment, you are having more oxygen, it will go to your lungs. From your lungs, what will happen? Lungs will be having more CO2 as compared to environment. So what will happen? This CO2 will be coming out from the lungs, right? And now lungs will be having more oxygen, and this blood vessel which is going to come, this blood vessel will be having what? More of CO2 and less of oxygen. This is going to be a blood vessel which is having more of oxygen, which is having more CO2. That is why it is coming to the lungs, right? So what is going to happen? This blood vessel, what we are going to do? We are going to give what? We are going to give oxygen here, and this CO2 will be more here. So this CO2 will be coming to your lungs now. Okay, and this oxygen will be more here. So this oxygen will be going to the vessel now, right? And now you are having the tissue. Around the tissue, also the same thing is going to happen. Just try to understand here. So let me just make it red. This is a vessel. We do not have multiple vessels, guys. We are having a single pipeline and a single motor. What I want to teach you, we have a single pipeline and a single motor. What is the motor? Heart. What is the pipeline? This vessel. If it is having oxygenated blood, we call it what? Artery. If it is having fenestration, we call it what? Capillary. Enough. And if it is having deoxygenated blood, we call it what? Veins, right? And just try to understand here, we are going to have a tissue, and tissue will be having what? Cells, and cells will require what? Oxygen. Oxygen goes into the mitochondria, it will produce the energy. This is the basic funda we are having. Now this vessel is going, and the cells will be utilizing oxygen, so they are going to make what? CO2. So here you will be having more CO2, yes or no? Yes. And here you will be having less of oxygen, yes or no? So this oxygen is going to transfer where? Into the tissue. And this CO2 will be going where? Into the veins. The CO2 will be going, and this is how this thing is happening, right? This is the basic funda, and this is known as simple osmosis or diffusion, right? Second type of transport we are having is going to be what? Active transport. Active means it will require some kind of energy, right? We can have two types of transport here. One is going to be vesicular, another one is going to be with the help of pumps, right? Vesicular means if you are engulfing something, this is known as exocytosis or endocytosis. This is known as endocytosis. If you are releasing something out, this is known as exocytosis. So we can have two things. One is endocytosis, another one is exocytosis. Endo means engulfing something. If the material is solid, we call it what? Phagocytosis. If the material is liquid, we call it what? Pinocytosis. Pina, you understand? Pina is drinking, right? So cell drinking is going to be pinocytosis. Cell eating is going to be phagocytosis. Both of them are what? Endocytosis. And this endocytosis is due to two important proteins. This is the second thing you have to remember. What are the two important proteins? These are going to be megalin and clathrine. Megalin and clathrine, this is your previous year question. Megalin and clathrine are the two important proteins. Write it somewhere else. You cannot zoom. And for exocytosis also you can write, this is going to be having a snare protein, SNARE, snare protein. This one will be having the snare protein. This one will be having the snare protein. If a single thing is going inside, this is known as symport. If one thing is going, one thing is coming, this is known as antipode. This is known as antipode. If both the things are going in the same direction, this is known as symport, right? So we can have this primary active transport, we can have this secondary active transport. With the pumps, we can have primary active transport. We can also have secondary active transport. So what is this primary? What is this secondary active transport? Try to understand. Primary active transport, you will be utilizing energy for the same pump. Okay. The example you can remember, simple remember the example proton pump. They're generally asking question or sodium potassium ATPase pump. These two examples you can remember. Secondary active transport, the trick you have to remember whenever you see any kind of sim port, whenever you see any kind of anti port, you see exchanger, you see co-transporter, these type of words when you see, you will mark your answer as what? Secondary active transport. So this is with the help of pump. We can have primary active, we can have secondary active. We can have primary active, we can have secondary active. Is that okay? Primary active transport, secondary active transport. This is with the sodium, potassium, ATPase pump will be there, proton pump will be there. Secondary active transport will be sim port. We will be having antiport. We will be having exchanger. We will be having transporter, co-transporter. All these things will be coming in, right? So how this thing can transfer across the cell, this is known as types of transport. We can have passive type of transport. We can have active type of transport. How many types in the passive? We can have facilitated diffusion. We can have simple diffusion. Facilitated diffusion, two examples. What are the two examples? Everyone speak. What are the examples? Glut and aquaporins. Okay. For active transport, we can have vesicular transport. We can have pumps. Vesicular, we have seen vesicle will be coming inside. That is known as endocytosis. Vesicle will be coming inside. That is known as endocytosis. Engulfing the vesicle is endocytosis. Okay. And removing the vesicle out is known as exocytosis. Endocytosis, what are the two important proteins we have discussed? Megalin and glycerin. Endocytosis, two important proteins. These are megalin and glycerin. For exocytosis, snare protein, right? Then we are having pumps. Pumps will be having primary and secondary. Primary will be proton pump inhibitor, sodium. Secondary will be, sir, any symport, antiport, exchanger, co-transporter. Like they give you example, sodium iodide symport is example of, or they can give you bicarb fluoride exchanger is example of. These are the example of four options they will give you: simple diffusion, facilitated diffusion, primary active, secondary active. What you will be marking? Secondary active transport will be there. Right? This is going to be the answer in this particular case, right? So we will take a short break here. Lunch break at what time you want? 2:30. 2:30 will be okay. 2:30. Okay, because lunch after lunch you will be having with system activation. Sympathetic, parasympathetic. Parasympathetic, and you will do the digestion of the food, right? So we can have it 10 minutes is enough. 10 minutes, 10 minutes is enough, right? Go have some oxygen. What you want to do? ठीक कब तक होगा सर? How to do that? All right. You can open the window. Window open करना है. Window. All right. Audio is fine, guys. Online people. So now we are going to discuss about the next thing. Next thing is about the body fluids. What are the body fluids we are having? We are going to discuss about that. So what is the body fluid? Total body fluid is going to be what? Let's say anyone is having a weight 70 kg. So he will be having 60% of total body water. That means 42 liter will be what? Total body water will be there. Now this total body water can be, this 42-liter can be inside the cell. We are having the cell as the structural and functional unit. So it can be inside the cell. It can be outside the cell. So we can have extracellular fluid. We can have intracellular fluid. How much is the intracellular? 28 liter. How much is the extracellular? 14 liter. That is going to be two-third and one-third, right? And then this extracellular is further divided into interstitial and plasma, into interstitial and plasma. So you can understand we are having multiple cells, like we are having these multiple cells, okay? And we are also having what? We are also having the, this is going to be suppose like plasma. So we are having this fluid, either it can be inside the cell, this is known as intracellular, either it can be outside the cell, this is known as extracellular. This extracellular can be of two type, either it can present in the blood vessel, this is known as plasma, either it can present in the between two cells, this is known as which fluid? Interstitial fluid. You understand? So total body water, extracellular, intracellular, extracellular can be inside the, extracellular can be between the two cells. This is known as interstitial fluid, or it can be in the plasma. That means in the blood. That means in the blood. This plasma is going to be in the vessel, right? So this is the total body composition of a person. Now they are asking what are the different dyes that we are going to use. So for total body water, the dye we are going to use is going to be something like water. These are going to be your tritium. These are going to be your deuterium or antipyrine, right? For extracellular fluid, we can use inulin. That is what is important, and this inulin is also responsible for the measurement of one more thing. What is that? This inulin can also identify what? Try to answer this one, right? Apart from that, we are also having intracellular fluid. How to calculate intracellular fluid? Total nikalo. You can understand the total. You can subtract the extracellular. This is going to be what? Intracellular fluid. What about this plasma volume? How you can calculate this plasma volume? You can use Evans blue dye. Very, very important. Evans blue. You can also use iodinated albumin. You can also use iodinated albumin. For identification of blood volume, you can use something like blood. This is going to be 51 chromium labeled RBCs. You can use 51 chromium labeled RBCs. For interstitial fluid calculation, you can do extracellular, you can calculate, you can subtract the plasma volume. So for for interstitial fluid, how you can calculate? You can calculate extracellular, you will subtract plasma, what will left? Interstitial fluid. Just see once and you will be able to understand what are they and how they are working, right? So now let's talk about the blood. How much is the blood in your body? Let's say 5 liter. What are the components of blood? Blood will be having what? Blood will be having cells. Okay. Blood will be having cells. Blood will be having plasma. Right? How much cells will be there? 40%. Plasma will be 60%. Plasma will be 60%. Now these cells can be RBC, WBC, or what are the different cells we are having? We are having RBC, we are having WBC, we are having platelets. You answer me. It's a rapid revision, right? So we are having plasma. Plasma will be having two things. We can have what? Solid. We can have liquid, right? In our solids, basically liquid is going to be there. Liquid is going to be 92%. That is going to be what? Water. Liquid is going to be water. And you will be having 8% of solids. And now the solids can be organic solid, inorganic solid. But what you need to remember, these solids which are going to be there, they are going to have everything. What I'm teaching you about the connective tissue blood. And blood will be present in the body, and this blood is responsible for all the things. This blood will be responsible for all the transport of substances. So this, what are the things which are present in the blood? I take your blood, what are the things will be there in the blood? It will be having cells, it will be having plasma. In cells, you have RBC, WBC, platelets. In plasma, you have what? You have liquid, 92% that would be water. Apart from that, solid will be there. Those solids will be having what? Hormones are going to be present in the blood. All those enzymes which are going to be present in the blood, all the waste product which is going to be present in the blood, all the drugs you have taken, right? Or everything that you have taken, everything that is present in the blood should be where? In which part? All the gases, all the solids should be where? In the solid part, right? Everything should be coming here, inorganic and organic solid part, right? Now, what is going to happen? Now, remember these drugs that we are having. What are the apart from that, you are also having what here? Plasma proteins are also going to be here. These are your albumin, globulin, and fibrinogen. These are going to be your plasma protein. These are going to be your plasma proteins. Now let's talk about the first blood thing we are having. That is going to be your RBC, red blood cells. What is the normal value of RBCs? 16,000 dollars or what? What is the value? RBC, how much percentage? Tell me something. 6,000 what? 3.5 to 4.5. Only 6,000 is going to be not enough, right? 3.5 to 4.5 million RBCs per cubic mm of blood. Per cubic mm of blood. Okay, you are going to make it cube, and that would be having how much RBCs? 3.5 to 4.5 million. You are considered millionaire as far as this RBCs are concerned, right? We are millionaires. We are having neurons. Currency is different, but yes, we are millionaires, right? So this RBCs are going to have what they are going to do. They are going to have what hemoglobin will be there, and the function of RBC is to transport what? Oxygen, not carbon dioxide. Oxygen. CO2 will transport in the form of bicarb fluoride exchanger, 70% of CO2. Whereas oxygen transport is the major function of what? RBC, red blood cells. Right? When you have decrease in the levels of RBC, this is what is known as decreased hemoglobin. That is going to be what? Anemia in the person. And how you are going to identify anemia? When you are going to identify the levels of anemia, you will be having hemoglobin. What is the cutoff value when you are going to give transfusion to the patient? Like if someone is having 5 HP, you are going to give blood or not? How much? 1 unit of RBC, 1 unit of blood will be having 350 ml in India, right? 1 unit is going to be 350 ml, and this 350 ml is going to increase 1 gram percentage of hemoglobin. So if you give if your hemoglobin was 5 and you are giving 1 unit, this is the sign of unit. This is the sign of unit. Okay, so this is going to be 1 unit. If you are giving 1 unit, what is going to happen? This 5 hemoglobin is going to become what? It will become 6. And what is the cutoff value? We will be giving this patient for the treatment, we will be giving 2 units of blood. 2 unit देंगे, we are going to give 2 units of blood, and then we are going to give what? We are going to check for MCV. We are going to check for MCV, and then we are going to identify the cause. So 7 is the cutoff value. Basically, we give 2 units of blood, it will become what? 7. It will become what? 7. If this patient is having hemoglobin of 3, we will be giving how many units of blood? 4. Total make it 7, right? 4 unit of blood means 4 unit of packed RBC. RBCs are low. Why to give everything, right? Just give the RBCs to the patient, he will be corrected, right? So we will be having this particular thing firstly. Second thing, what we can do? Second thing, we are going to check for the MCV of this patient. If MCV is coming to be low, less than 80, or it is coming out to be more than 100, then we are going to assess the cause. Less than 80, it is going to be more likely iron deficiency anemia. Other causes are also going to be there. More than 100, it can be due to B9 or B12 deficiency, and then we will treat the specific cause. Then we will treat the specific cause depending on the deficiency this patient is having, right? So based on the identification, we are going to treat this patient. What about WBC? Normal value of WBC? 11 to 4? 4 to 11. Yes. So this is going to have the 4,000 to 11,000 is the value of WBC. Right? If value is going to be less than 4K, that is going to be what? Less than 4K is going to be what? Leukopenia. Okay. More than 11K, that is going to be leukocytosis. That is going to be leukocytosis. Okay. More than 20, it's suggestive of sepsis, blood infection. Okay, infection is there. And more than 50K is suggestive of the cancer. This is going to be your leukemia. This is going to be your leukemia. How many types of WBCs you are having? You are having 2 types of WBC. We can have granulocyte and agranulocyte. Granulocyte can be eosinophil. They will be having what? Granules will be there. Granulocyte means cell. Granules will be there. So we are having filled. Those granules, so we call them filled. We are having 3 fill. What are the 3 fill? Basophil, eosinophil, and neutrophil. Agranulocyte will be monocyte and lymphocytes. Okay, you can remember this. If someone is having bacterial infection, how you will get to know which levels will be increased? This neutrophil is suggestive of bacterial infection. These lymphocytes are suggestive of viral infection. And eosinophil will tell us about the parasitic infection. Right? These things you can remember. So you are having raised levels of eosinophil, basophil, neutrophils. You are going to understand, okay, this patient might be having this particular infection. Apart from WBC, we are also having one more cell. This is going to be your platelet. The number of platelet is going to be how much? 1.5 lakhs to 4.5 lakhs. This is going to be what? Normal levels of platelet count. Platelet has a function in the clotting. It is going to do what? It is going to do clotting. It is going to make what? Primary hemostasis. It is going to stop the blood. This platelets can be of 2 types. We can have 2 types of platelets. In which disease we have decrease in the platelets? Levels of platelets will be decreased. Dengue. In dengue, you will be having decrease in the platelet count. That is going to be thrombocytopenia. If you have increased platelet, that is going to be thrombocytosis. Okay, thrombocytopenia can be there. For the treatment of this thrombocytopenia, if the platelet count is coming less than 30,000, what is the cutoff? If platelet is less than 30,000, we are going to administer platelet in this patient. How many types of platelets you know? SDP, RTP. Random donor platelet and single donor platelet. Random donor will increase the platelet count by 10,000. 10,000. And it will increase the platelet count by 30,000. It will increase the platelet count by 30,000. 30,000. Remember, this platelet is concerned with primary hemostasis. First time bleeding that is stopped, this is known as primary hemostasis. Right? What is the ultimate treatment would you like to give in the patients of dengue? IV fluids. Remember, any viral disease, until or unless it is diagnosed, we are only going to give what treatment as water as hydration. Like in the cases of common cold, normal common cold, we will tell our patient to drink plenty of fluids, like lots and lots of fluids he should be taking, right? That is the treatment we would like to give. Next one is homeostasis. What is homeostasis? Homeostasis is maintenance of internal body environment as compared to external body environment. That means your body will be having a constancy. The body is going to make what? Constancy. So we are having certain feedback mechanisms which are working for this constancy. The first one we are having is known as negative feedback. Negative feedback means increase in something will lead to decrease in something. Increase in something will lead to decrease in something. For example, we are having summers, right? In summers, what is going to happen? You will be having more temperature outside. So what your body will do, it will do the perspiration, it will remove out the sweat. So that what will happen? Skin cooling will be there. Okay. In winters, what your body will do? Remember one concept. What is the concept? Whenever your vessel is dilated, you will be having something coming out of the vessel. Vessel is dilated, that means something is coming out. So vasodilation is going to happen in the summer. In the summer, we have the vasodilation, right? In the winter, we are going to have what? Vasoconstriction will be there, and vasoconstriction will lead to increase in the BP, and this increase in BP will generate some temperature. Blood flow will be faster. That is why you live in Russia, right? In Kazakhstan, Kyrgyzstan. So what was happening over there? You will be having more urination. You drink some water, you go outside in the cold. What is happening? You will be having more urination. What is the reason behind this? Your body is producing what? Your body is increasing the vasoconstriction, and because of that vasoconstriction, you will be having increase in the BP, and that BP increment will lead to increase in the filtration from the kidney, and that filtration will lead to increase in the urination. You understand this, right? So this is a type of negative feedback. That means increase in something will lead to decrease in something. Like your BP is increased, what your body will do, your body will automatically decrease the BP. This is going to be the negative feedback. What is feed forward? Feed forward means just thinking about something. Just thinking about the food, you are having what? Salivation in your mouth or gastric acid release in your stomach. This is known as feed forward mechanism. It is also known as anticipatory mechanism. Feed forward also known as anticipatory mechanism. The next one we are having is positive feedback. This positive feedback is going to be what? Your feed forward, they can give you example. That means thinking about something is happening in your body. This is going to be also known as feed forward, also known as anticipatory system. है ना? Right? So what is going to happen? Like you are about to go to gym. You will think like going to the gym, what will happen? Your body will increase your, just thinking about the gym, your body will increase your respiratory rate, body will increase your heart rate. These are what? These are anticipatory changes. That means before going to the gym, you are having these changes. What is positive feedback? The example is going to be what? The mnemonic is going to be claps. The mnemonic is going to be claps. C4, you will be having what? Clotting will be there. L4, LH surge. A4, action potential. P4, parturition. And S4, shock. All these things are going to show you which kind of mechanism. This is going to show you positive feedback. Positive feedback means activation of something will lead to further activation of something, right? You are having a baby inside the womb and this baby is trying to come out. Once this baby will try to come out, you have the rupture of the membrane, rupture of the bag, and now definitely this baby will be coming out. It is going to be a type of parturition. Parturition is a type of positive feedback. Clotting, you activate one factor, automatically this complete cycle will begin and you will be having what? You will be having formation of another factors, right? So these are the examples of positive feedback. These are the examples of positive feedback. Now we are having cellular junctions. What are these cellular junctions we are having? How these two cells are combined together, right? So we are having this tight junctions, we are having this adherent junctions, we are having desmosomes, gap junctions, and hemidesmosomes. Okay, tight junctions are made present where? In the blood-brain barrier, in the blood-testis barrier. Blood-brain barrier or blood-testis barrier, they are made up of which protein? Claudin and occludin. Claudin or occludin. Adherent junction, you will discuss about E-cadherins. Cadherins. Okay. Desmosomes we are having, they are going to bind two keratinocytes together. Tomorrow I'll teach you about this desmosome thing. And gap junctions are going to be present maximally where? In the heart. Okay. And if you have a disease, this disease is known as Charcot-Marie tooth disease. This disease is known as CMTD, Charcot-Marie tooth disease. And hemidesmosomes are going to bind these keratinocytes to the, this is your basement membrane. So they are going to bind these cells to the basement membrane. These are known as hemidesmosomes. What are the example we are having? We are having BPHE1, BPHE2. This thing also we are going to discuss tomorrow. So if there is mutation of this desmosomes, you will be having a disease. And if there is mutation of this BPHE1 and 2, you will have a disease. What is the disease? This upper one is going to be, you have completed dermatology? You have studied dermatology? Yes or no? Derma completed or not? Yes or no? So this is your BPHE2, BPHE1. This BPHE is going to cause a disease. This is known as bullous pemphigoid. So we can have pemphigus group of disorder. We can have bullous pemphigoid group of disorders. Just listen this for now. Tomorrow I will explain this. Okay. These are going to be bullous pemphigus and pemphigus group of disorder. Now we are going to discuss about the second chapter, that is going to be the kidney. What is the function of kidney? What is the size of kidney? What is the size of the kidney? Kidney is going to be 4 to 5 inch. What is the extent of kidney? From T2, T12 to L3, T12 to L3. It is going to be a retroperitoneal organ. That means it is present on the backside of the body, right? Its function, major function is to do the excretion of the substances. Whatever we are eating, it will be doing what? Excretion, right? So eating things, it will be having glucose. That glucose will go to blood, and whatever blood we are having, it is going to do what? Excretion of the bad substances. It will do electrolyte secretions. It will make what? Amniotic fluid. What is this amniotic fluid? What is amniotic fluid? Urine. Amniotic fluid is the urine. When baby is inside the womb, when the baby is inside the womb, every organ is working apart from the lungs. Every organ is working. So baby is having kidney. Kidneys are working. Kidneys are going to make what? They are going to make the urine. What are the hormones we are having? The hormone we are having is going to be renin, and this renin is responsible for what? This is going to come from which cells? JG cells. This is going to come from juxtaglomerular cells or paraglomerular cells. Juxta or para means same. This is going to be nearby. Okay. Second hormone we are having, this is going to be erythropoietin. Those people who are having kidney dysfunction, kidneys are not functioning, we are giving what? Erythropoietin from outside. And this 1,2,5 dihydroxycholecalciferol, also known as vitamin D3, vitamin D3. This is also coming from the parts of the PCT. This is also coming from the parts of the PCT. What is the functional unit of kidney? This is going to be your nephrons. We are having 1.2 to 1.3 million nephrons per kidney. Right? Here you will be having a process. This process is known as ultrafiltration. Before that, tell me what is GFR? How much is that? AC चला दो यार. AC on that one you know. Okay. So we are having this particular thing. GFR. What is GFR? Glomerular filtration rate. It is going to be 125 ml per minute. Let's try to understand this, how it is going to come out. I'll make a short story so that you can understand. In a day, how many minutes are there? In a day, how much urine do you pass? 1 to 2 liter. That would be approximately 1500 ml urine you are passing. In a day, how many minutes we are having? Right? So can I say approximately every minute you are making what? 1 ml of urine. Your kidneys are making every minute 1 ml of urine. Right? What is cardiac output? Cardiac output is heart rate into stroke volume. So heart rate is going to be 72. Stroke volume is coming out around 70. It will be approximately coming like 5 liters per minute. Right? So every minute your motor, what is the motor we are having? Cardiac output is what? Every minute, how much blood is coming out from your motor? That is going to be the thing. And cardiac output means how much blood is coming from the heart. So every minute your heart will be releasing how much blood? 5 liters of blood. Right? Out of that 5 liter of blood, which is coming out from the heart, how much is going to the kidney? 20% is going to the kidney. That is going to be how much? 1 liter. 1 liter. And out of that 1 liter, now you know the components of blood. That is going to have what? 40% will be cells and 60% will be plasma. So 40% will be cells and 60% will be plasma. 60% is going to be 600 ml. Right? So 600 ml plasma will be going to the kidney. Cells are not going to get filtered. Do we have RBCs, WBCs, platelets in the blood, in the urine? No. Cells are not going to get filtered. Only RBC, only plasma is going to get filtered. Out of that 600 ml of plasma, 20% is going to get filtered, and this is going to come out somewhere around 120 ml per minute. And this is what is known as what? GFR. This is what is known as GFR. Think like that. This is a normal story. Your heart is releasing how much blood in a day? 5 liter in a minute. 5 liter per minute. Right? Out of that 5 liter, how much is going to kidney? 1 liter, that is going to be the 20%. Out of that 1 liter blood, there will be 40% cell, that is 400 ml will be cell, 600 ml will be plasma. And that plasma will be further filtered, 20% of the plasma will be filtered, and it is going to become what? 120 ml. This is going to be known as GFR, glomerular filtration rate. Okay, let me just summarize it here. So your heart will be there, 600 ml will be coming to the kidney, and out of that 600 ml, this is going to be 600 ml. This is known as renal blood flow, renal plasma flow more precisely. This is known as renal plasma flow, isn't it? 600 ml of fluid will be coming to the kidney, and out of that 600 ml, how much is getting filtered here? This is known as what? This is known as GFR. It is going to be how much? 125 ml per minute, right? And remaining will be going away from here. This is going to be what? This is going to be afferent arteriole. This is going to be efferent arteriole. You understand this? So this is going to be 125 ml per minute, which is going to the kidney. And out of 125 ml per minute, how much urine you are making in a day? In a minute, how much urine you are making? 1 ml. So what about this 124 ml? Are you understanding the fact? Your kidneys will be making what? 1 ml of urine per minute. You already know this. From where this urine is going to get come from? This is the urine which is coming from the blood. This is the urine we are making from the blood. So heart will be releasing 5 liter of blood. Look here, everyone. Heart will be releasing 5 liter of blood. Out of that 5 liter, how much is going to the kidney? 20%. That is going to be 1 liter. Out of that 1 liter, 40% will be cells. 600 ml will be plasma. 60% will be plasma. And out of that plasma, only 20% is getting filtered. So this is going to be approximately 125 ml is the GFR. In a normal day, you are passing 1,500 ml of urine, and you are having 40 minutes. So I know 1 ml urine will be formed per minute. And this urine will be stored where? In the bladder. And this is how you are just urinating 400, 500 ml of urine. And this is what we are having basically. This is the basic funda, right? So now what is going to happen? We are going to have this particular GFR, and after GFR, this is a proximal part. This is the first part. Is it convoluted? Yes, sir. This is convoluted. So can I call it PCT, proximal convoluted tubule? Then we are having descending limb of loop of Henle, and this ascending limb of loop of Henle. Then this part comes. This is also convoluted, isn't it? And this is proximal or distal? Distal. So this is known as distal convoluted tubule. Then we have the collecting ducts. Collecting ducts will be there. Multiple collecting ducts will be draining where? You will be having two ureters coming from both the kidneys, and these ureters are going to drain their urine into bladder, and from bladder this urine will be coming out, and this urine will be going through the urethra to the urinal, right? And how much is the urine which is filled in the bladder? That is going to be 1 ml per minute. Out of that 125 ml which is coming to the kidney, only 1 ml per minute is coming to the bladder. That means 124 or 99% of the urine is going to get reabsorbed here. This is how efficient your kidneys are, right? So let's try to understand where this absorption is going to take place and how this thing is known as, right? This particular process is known as ultrafiltration, and here you will be having these pores will be there. If you will be having plasma proteins coming out, if RBCs are coming, they are not going to cross this because they are small. These pores are going to be small. They are having negative charge, so it will let the RBCs to come out. Why RBCs are not getting filtered? This is the reason we are having what? Ultra filtration. We are having three steps. One step is the size, second step is the charge, and third step is going to be these things are known as podocytes. Podocytes, right? Suppose RBC is trying to come here and it is trying to pass this particular layer. This RBC is trying to pass this. Is it going to pass? No, it is big. If there is a plasma protein which is trying to pass, is it going to pass normally? No, sir, it is big. Can it pass? Is it able to pass this particular layer? No, it is not able to pass. This is a plasma protein and this is a RBC. And in pathology, you study about diseases where you will be having proteinuria, you will be having hematuria. So what is happening here? You will be having some kind of a damage, and because of that, what is going to happen? Because of that damage, you are going to have this passage of this plasma proteins into the urine, and you are having passage of this RBCs into the urine. That means now the patient is having what? Certain kind of diseases, right? This particular structure that I'm showing you, this is the structure of what? This is the structure of this glomerular basement membrane. Here, this thing I'm showing you, this ultrafiltration is happening where? This ultrafiltration is happening somewhere here. Normally, sir, urine में क्या नहीं आना चाहिए? What should not come to the urine? RBCs, plasma protein should not come into the urine. But when you have rupture over here, when you have damage over here, what will happen? You can have proteinuria, you can have hematuria, and effectively symptoms will also be there, right? Now comes the first part. What is the first part we are having? This is going to be the PCT. Remember the important points about PCT. PCT is going to absorb 65% of the sodium. Along with the sodium, water will be absorbed. So what is going to happen? 65% of water absorption will be there. The important thing they are asking, 100% of glucose and 100% of amino acid will be getting reabsorbed where? In the PCT, in the PCT. Okay, maximum reabsorption will be there. It will be having certain enzymes like carbonic anhydrase pump will be there. And what is the drug that will be working on carbonic anhydrase? This drug is known as acetazolamide. This acetazolamide is the drug which is working in the carbonic anhydrase pump, and it is the drug of choice for mountain sickness. Side effect you can remember, these are going to be your hypokalemia and paresthesias can happen. What are the other things, other drugs you can use? These are going to be your brinzolamide and dorzolamide. They can be used to decrease the IOP, to decrease the IOP in the children, right? We can also use these drugs. Two questions you have to remember, 80% of bicarb, 70% of calcium, and 100% of glucose and amino acid. Now comes the second part, because second part will be having loop of Henle. Okay, loop of Henle will be there, and this is the lumen I'm talking about. This is your loop of Henle, and in here in loop of Henle you will be having certain cells. Just look here once. Certain cells will be there, and nearby that you will be having the blood vessel, right? So what is going to happen? This loop of Henle will be having with cells sodium, potassium, 2 chloride pump will be there. This is the loop of Henle where you will be having sodium, potassium, 2 chloride pump. Nearby this, I'm assuming we are having a blood vessel, and this is going to be the epithelial cell. This is going to be the layer where you will be having what? यहाँ पर क्या है? What is the thing we are having over here? Urine will be there, right? So let's try to understand what we can do to this particular thing. Normally, here we are having what? Urine, and this urine is going away. This is the normal funda. This is the normal funda. What is going to happen? This urine is going to go away, and here you will be having certain pumps, sodium, potassium, chloride pump, and these sodium, potassium, chloride pump are going to absorb sodium. And what is going to happen? Sodium is going to get reabsorbed. Remember, sodium के साथ में क्या जाएगा हमेशा? What is the thing which is going to follow sodium? Water. So what is going to happen? It is going to absorb the sodium, and it is going to absorb the water as well, right? So what is happening? This is the loop of Henle, and here you are having absorption of sodium, absorption of water is also happening, right? If water is absorbed, that means sir, less urine will be formed. You understand this? Now, this is the basic understanding, right? Now comes the next part. It will be also having some pumps for calcium. They are working together. It is going to absorb sodium. It is going to absorb calcium. Both the things are getting reabsorbed. Now comes the next part. Next part is going to be DCT, distal convoluted tubule. In this part, which pump is there? Sir, sodium chloride pump is there. Along with that, calcium pump is also be there. Right? What this sodium chloride pump is going to do? It is going to absorb sodium. It is going to absorb chloride. It is going to absorb water. This is the simple funda that is happening. Right? Normally, PCT will be having how much absorption of sodium? 65%. This loop of Henle will be having 25% absorption of sodium. And this DCT will be having 6 to 8% absorption of sodium. And lastly, collecting duct will be having what? 2 to 3% of absorption of sodium will be there. Right? So this is going to be your DCT. In DCT, you will be having sodium absorption, and 6 to 8% of sodium absorption will lead to 6 to 8% of water absorption also. Lastly, we are having collecting duct. In collecting duct, which pump is there? This is going to be your E-neck pump. E-neck is going to be what? Epithelial sodium channels will be there. And this is going to do what? It is going to absorb sodium, and it is going to absorb chloride also, right? So what will happen? Sodium absorption will lead to water absorption. You will be having accumulation of water, right? Instead of absorbing sodium, it is going to release what? Potassium and H plus. If it is absorbing the sodium, it will release potassium and H plus, and that is what is going to cause what? This potassium and this H plus is going to cause acidity of the urine. Okay, you understand this? Now let's try to come back. We are having PCT. I'll just give you the recap, right? What is this thing is happening? PCT will be having which pump? Speak. Carbonic anhydrous pump. How much amount of sodium will be reabsorbed? 65% of sodium will be reabsorbed, right? Second pump we are having is loop of Henle. Loop of Henle will be present somewhere here. Here we are making what? Urine making. We are making what? Urine. So here you are going to have what? In thick ascending limb of loop of Henle, we are going to have this particular sodium chloride potassium, sodium potassium 2 chloride pump, and it is going to absorb 25% of the sodium. Now you can use your drugs here whenever you want to remove the excess of fluid. Whenever you are having diseases like pulmonary edema, that means your lungs are having the water. You are having CSF. CSF is also going to have what? Lungs will be having water. You are having hypercalcemia. In these conditions, you want to remove what? You want to remove excess of water. What you can do? You can block this pump. You give a drug, you block this pump. Now what is going to happen? Do you think this sodium is coming inside into the body? No. If this sodium is not going to come inside, do you think water is going to come inside to the body? No. If water is not coming inside the body, it will be going out into the urine. So that is what we are doing in the cases of pulmonary edema, in the cases of fluid accumulation in the body. Whenever you have fluid accumulation in the body, okay, so that is what we are doing in the drugs like furosemide. They are going to block what? This particular pump, and torsemide is also going to block this pump, right? So what is going to happen? If this pump is not working, remember, if this pump is not working, what will happen to the other pump? This calcium is also not going to work. And if this pump is not working, this is not working, what will happen? This calcium will go out into the urine. So both the pumps are together, they are working together, they are the brothers for life. Okay, think like that. It will be easy for you. Both the pumps are working together, right? Uses, I've told you. Side effect will be what? Side effect, you can simply remember, if you are blocking this, what is going to happen? Sodium is not going to come inside. If you are blocking this, what is going to happen? Sodium is not going to come inside. Hyponatremia will be there. Potassium not coming inside. Magnesemia, potassiemia will be there, right? And decrease in H plus will also be there, right? All the thing will be decreased. Whereas what is going to increase? This is going to be the glucose. This is going to be the lipid. This is going to be the uric acid. Remember, these things are going to cause hyperuricemia. Okay. So avoid it in the gout patient. Avoid it in the gout patient. Next pump we are having. Before that, if there is mutation of this particular pump, there will be a specific syndrome. This syndrome is known as Bartter syndrome. What is the name of the syndrome? What is the name? Bartter syndrome, right? Now comes the DCT. Here also you can use certain drugs. You can block this pump, DCT pump. Okay, you can block this DCT pump. And what is going to happen? If you block this DCT pump, what is going to happen? Screen is already shared. And now, okay. So what is going to be the thing we are having here? Let's talk about the DCT again. So DCT will be having what? This particular pump, that is going to be the sodium chloride pump. If I'm blocking this pump, this is going to be what? If I'm blocking this pump, do you think this sodium is coming inside? No. If the sodium is not coming inside, it is going out into the urine. It is going out into the urine, and we can remove the fluid from the body, right? We can remove the fluid from the body over here. Okay, and we can remove the fluid from the body over here, right, by blocking these sodium chloride pump. And the drugs which are working over here, they are known as thiazides. They are known as thiazides. These are your chlorthalidone. We are having chlorthiazide. Mutation of this particular pump will lead to a specific syndrome. The name of the syndrome is Gitelman syndrome. Gitelman syndrome, right? Where you can use these drugs in the cases of hypertension, in the cases of osteoporosis. Remember, these two pumps are not going to work together. Okay, these two are not going to work together. That means if you block this, only this one will be blocked. Earlier, what we have seen here, if I'm blocking this one is also blocking. Both are working together. They are brothers, right? But they are not brothers. They are not working together. So if you block this one is only blocked. This calcium absorption keeps on happening, right? So this is going to cause, or this is going to be helpful in the patients of osteoporosis, right? In osteoporosis, we want more calcium in the body, so we want more absorption of calcium from the urine, and this calcium we want in our blood, right? So this is what they ask you. If there is a patient with osteoporosis and hypertension, what would you like to administer to this particular patient? This is going to be the drugs, right? Collecting duct will be having what? Collecting duct will be having these iliac channels. And remember, these iliac channels will be working how? Here you will be having aldosterone coming, and this aldosterone is coming from zona glomerulosa. From which gland? Adrenal cortex. Adrenal cortex will be releasing this will be having the zona glomerulosa, that is the uppermost part, which is going to release aldosterone. And this aldosterone is going to come, and it is going to bind through this side of the membrane, this side of the cell. This is going to be the basolateral side, right? So here it is going to come, and its function is what? Aldosterone has a function to make what? It is going to make your ENAC channel. What is ENAC channel? Epithelial sodium channel. The more sodium channel will be there, just think like that. If the urine is formed here, urine formation is happening, right? This urine is coming from above. Now just understand, if you have more sodium channel, what will happen? More water absorption will happen, yes or no? More sodium channel means more water absorption. So more aldosterone means more sodium channel, and more sodium channel means more water reabsorption, right? And more water is coming inside. What is going to happen? More potassium will be lost, more H plus will be lost, right? They are working opposite to each one, right? So whenever you have sodium absorption, you need to give something out, that is going to be potassium and H plus, right? So if I'm blocking this particular pump, if I'm blocking this particular pump, what is going to happen? If I'm blocking this, do you think sodium will come inside in the body now? If I'm blocking this pump, do you think sodium will come inside? Sodium will not come inside. That means water will also come inside or not come inside? No. If water is not coming inside, that means water will be going outside in the urine. Yes or no? Yes, there will be more urination, right? And what will happen if this pump is not working? Do you think we are going to lose potassium? No. This potassium will be going out or not? No. If sodium is not coming inside, no need to send potassium and H plus outside, right? If sodium is not coming inside, that means potassium is also not going to go outside. If potassium is not going outside, these are known as potassium sparing diuretics. You have studied about potassium sparing diuretics, right? So these are going to be the potassium sparing diuretics. If you block this aldosterone, what is going to happen? Just try to understand this very important concept. You will be having adrenal cortex. It will be releasing what? Zona glomerulosa layer will be releasing aldosterone. This aldosterone will come to the kidney and it will bind here. It will bind here in the kidney and it will make what? Epithelial sodium channel. And the function of sodium channel is to absorb what? Sodium, right? Whatever amount of sodium it will absorb, it needs to release what? Potassium and H plus. Now what we are doing, this is the normal functioning. Now we are closing this sodium pump. We are closing this sodium pump. If sodium is closed, that means sodium will not come inside. And sodium will not come inside. Do you think we need to give potassium outside? No. If potassium is not going outside, they are known as potassium sparing diuretics, right? What are the example? The example will be paste drugs. What is the paste? We can have two drugs coming in the aldosterone receptor. We have two drugs coming in the ENaC channel blocker. Either I can directly block this channel, either I can block this one also, right? So these drugs which are working here, they are known as spironolactone and eplerenone. And those drugs which are going to be working here, these are known as amyloride or trimetrine. Trimetrine. These are going to be the drugs. We are having paste. Paste is going to be potassium sparing diuretics. This is going to be amyloride, spironolactone, trimetrine, and eplerenone. These are the drugs we are having. Or you can simply remember ENaC blockers are going to be what? They are going to be what mnemonic you can make. This is going to be EAT group of drugs, EAT, right? Remaining will be potassium sparing diuretics, right? ENaC mutation will lead to a syndrome. This is known as Liddle syndrome. If you are having excess of aldosterone, what will happen? Just try to understand. More aldosterone means what? It will be making which more channel? Let me see you understand or not. If you are having more aldosterone, what is going to happen? You will be having more sodium channel. More sodium channel means more sodium is going to come inside. If more sodium is coming inside in the body, what will happen? More water will come inside. Yes or no? More water will come inside in the body. And if your body will be having more water, that means you will be having hypervolemia or hypovolemia. Hypervolemia. And hypervolemia will lead to hypertension. Yes or no? Yes. So Cone syndrome patient will be having symptoms you can easily extract if you can remember. Here you will be having increase in the aldosterone. What is aldosterone decreased? Aldosterone decreased is known as Addison's disease. Aldosterone decreased is going to be Addison's disease, right? The second part, this is going to be the upper part of the collecting duct. Okay, lower part of the collecting duct will be having the last pump, and these are going to be your aquaporins. These are going to be your aquaporins. These are the aquaporins which are going to have functioning of anti-diuretic hormone. Now it will be functioning automatically, and this is known as anti-diuretic hormone. We are having three receptor V1, V2, V3. V1 is going to cause what? It is going to cause vasoconstriction. V1 is going to cause vasoconstriction. V2 is present in the aquaporins. Aqua means water. Porins means it is going to absorb the water. And third one we are having is going to be your V3 receptor, which is going to lead to release of SCTH. SCTH release will be there. V3 receptor. Right? So what is going to happen? Let's try to understand this. We are having this collecting duct, and here you will be having the urine, and this urine is passing from here. Now we are doing what? We are having this V2 pumps, and these V2 pumps are going to do what? They are going to absorb the water. They are aquaporins. Aquaporins means they are having the pore for the water only, so they are going to absorb the water. Is it going to be primary active transport, secondary active transport, facilitated diffusion, or osmosis? Remember two examples you have written. Blood and aquaporins are facilitated diffusion. That means do they need energy? No, they do not require energy. They will take care of the water and they will absorb all the water automatically. Right? This is the tube we are discussing. We are discussing this PCT part. Then we are discussing this loop of Henle part. Then we are discussing this DCT part. Then we have discussed about the upper part of the collecting duct. Now we are discussing here in the lower part of the collecting duct. In lower part of the collecting duct, you will be having what? Anti-diuretic hormone functioning. It will be having three receptors, V1, V2, V3. Which one receptor is going to be there in the kidney? V2. And this V2 is responsible for the absorption of water only, absorption of water only. It has nothing to do with the salt, right? So you can have two important diseases over here. If you have decrease in the levels of ADH, this is known as diabetes insipidus. If you have increase in the levels of ADH, you can have SIADH. Okay, I have explained you earlier. Can you appreciate? Can you answer me this? Why we are having diabetes insipidus? Decrease in ADH means what? Decrease in ADH means decrease in V2 receptor. Try to understand this, okay? I've given you the explanations in the main classes, but just try to understand this, right? You should have revised your notes and then it would be faster, right? So what is going to happen? If we are having this V2 receptors, this V2 receptor has a function to absorb the water. The function is to absorb the water. And now what is going to happen? You are having decrease in the ADH. You are having decrease in the ADH. If you are having decrease in the ADH, decrease in the V2 receptor will be there. Yes or no? If decrease in the V2 receptor, do you think there will be more water reabsorption? No. If not more water reabsorption, this water will be going out into the urine. Yes. And this patient will be having what? Polyuria. If this patient is having polyuria, he will be feeling thirsty. This is going to be polydipsia, and polydipsia and polyphagia will be happening together. They are in the close proximities, so they are going to happen together. So these are going to be the symptoms of what? Polyphagia, polyuria, polydipsia. These are the symptoms of diabetes, right? But this diabetes is known as diabetes insipidus. Now, this ADH can come from the brain, so we can have decrease ADH from the brain. This is known as central diabetes insipidus, and the drug of choice will be desmopressin. Whereas, if this problem is happening in the kidney, this is known as nephrogenic. Kidney means this particular part. If the problem is here. That means ADH is there in the body, but these receptors are not responding. This is known as nephrogenic diabetes insipidus, and the drug of choice will be Hyazines, right? In SIADH, what is going to happen? You are going to have increase in ADH. Here you will be having syndrome of inappropriate antidiuretic hormone. That means now you are having multiple receptors. More ADH means more receptor, isn't it? And more receptor means more water reabsorption. Yes or no? And what is this particular water we are having? This is going to be what? This is the only water reabsorption we are talking about. I'm not talking about the salt, right? So this is going to present with the symptom. That is what they are asking you in medicine, dilutional hyponatremia. What can happen in the patient? Dilutional means this patient is having dilution. Why? This patient is having only water reabsorption and this water is going to come into the body. Lots and lots of water will be in the body. Hypo means decrease. Natri means salt. Emia means in the blood. So here salt will be low and water will be more. Water will be more because this V2 receptors are working very nicely. You understand this? What is going to be there? And the drug of choice is going to be coniveptan. Drug of choice is going to be coniveptan. Okay. So these are going to be the steps. Now comes the bladder part. Now comes the bladder part. So what is going to happen when this urine is formed? This complete urine is going to come and store in the bladder. What is the capacity of your bladder? 500 to 700. 700 is the maximum capacity in some people, right? So it is under the parasympathetic control. How this thing is going to happen? how you are going to have urination when you will be having fulliness. For example, let's say, let me just give you example. This thing is based on a graphical representation I'm giving you. So suppose here you have done your urination. After the urination, what is going to happen? You will be having little bit increase in the pressure, and you will be having increase in the volume also. What is going to happen? You will be having increase in the pressure, you will be having increase in the volume first. Okay, you will be having bladder filling is happening. Then what happens? Like you are sitting, most of you are sitting in the class. Now you are in 1B stage. 1B stage means you are having increase in the volume. Okay, your bladder is getting filled, but do you feel the pressure? Are you feeling the urge to go? No, you are not feeling that, right? So this particular thing, this phase is known as Laplace law. This phase is based on a law. This phase 1B is based on Laplace law. And then what will happen? Then there will be a point when you will be having starting of the urge to urination, right? You will be having the start of the urge to urination, and this will increase, and then you have the marked sensation, and then you definitely need to go for urination. This is going to be the Laplace law. How this thing is going to happen? This is under the parasympathetic control. Just now we have seen in the beginning M1, M3, M5, right? Parasympathetic control is going to contract the bladder. It is going to contract which muscle? Detrusor muscle, followed by opening of internal sphincter. Internal sphincter will be opened, and then you will be having control over the external sphincter. That is going to be the under which control? Pudendal nerve, right? So pudendal nerve is going to control your external sphincter, and whenever you want, you can go for urination. You can control the urination, right? The size of the ureter is going to be what? How much? 30 millimeter. Ureter, right? These are going to be the ureter. And size of urethra in males, it is going to be 20 centimeter. In females, it is going to be 4 centimeter. After bladder comes the last part. This is going to be your RAS system. So what is this RAS? We have already discussed about the sympathetic nervous system. What you know about sympathetic nervous system? Beta 1 is going to have release two things. Beta 1 is present at two places. One is on your heart. Second is in your kidney. It is going to release what? Renin. And that renin is going to go where? It is going to increase BP. Let's understand how it is going to increase BP. If you understand this, you will already automatically understand all the drugs of BP as well, right? How it is going to do what? So your liver will be making certain enzyme. One of them is going to be angiotensinogen. And this angiotensinogen will convert into angiotensin 1. And this conversion is happening because of what? Renin. So renin is not directly increasing the BP. This renin is coming from which cells? JG cells. Now this angiotensin 1 is going to convert into angiotensin 2 with the help of one more enzyme. This is known as angiotensin converting enzyme, ACE enzyme. And now this angiotensin 2 is going to go where? In the adrenal cortex, and it is going to release what? It is going to go to adrenal cortex, and adrenal cortex zona glomerulosa, it is going to activate zona glomerulosa, and zona glomerulosa is going to release what? Aldosterone. Are you seeing the story? Right? This is the aldosterone. It has two function. It has two function. It will go to kidney first thing. It will go to kidney. It will make which channel? Now you already know aldosterone is going to make which channel? ENaC channel. And the function of ENaC channel is to do what? Retain sodium. And along with the sodium, what will happen? Water will be retented, right? So aldosterone act on the kidneys, stimulate reabsorption of sodium chloride and water, right? So this is the function of this particular thing. First thing, this is going to retain what? Sodium and water. Second thing, it is going to go to your blood vessel, and it is going to do what? Vasoconstriction. So this vasoconstriction is going to increase BP, and this is going to increase the fluid. This is going to increase the fluid, right? Fluid absorption will be increased, sodium absorption will be increased, leading to increase in the fluid. So ultimate story, you are understanding that renin, angiotensin, aldosterone system. It is a complete system. The function of the complete system is to increase the BP by increasing the fluid absorption from the kidney. And how this fluid absorption is increased? It is increased from the kidney. This is known as RAS mechanism. You understand this? I'll give you a quick recap of this particular thing that we have discussed here. We are having certain parts. You already know how much blood is coming here. This is going to be 125 ml per minute. This is known as GFR. Give your complete concentration for 5 minutes and then we will have a lunch break. Okay? Okay? Push. Right? So we are going to have this GFR. Now, what this GFR is going to do, this GFR is going into the first part. This is known as proximal convoluted tubule. This first part is known as PCT or proximal convoluted tubule. Here you will be having 100% of sugar, 100% of amino acid, 100% of sugar and amino acid basically, and 65% of salt reabsorption. Right? Here you will be having 125 ml of urine, which is being formed. Out of that, 65% will be reabsorbed here itself. 65% of salt will be reabsorbed, 65% of water will be reabsorbed. Sir, if jata where it is going where? So this is the efferent arteriole. It will come along it like that. Okay, this is going to run along with it, and here it will come back to the blood vessel. Absorption means what? It is coming back to the blood vessel. Right? You understand this? So 65% of water reabsorption is happening at the level of PCT. What is the drug which is going to work here? This is going to be your acetazolamide, right? After this, what we are going to have, this is going to be the descending limb of loop of Henle. It is also somewhat permeable to water only. And this is going to be the thick ascending limb of loop of Henle. And here you will be having which pump? Sodium, potassium, 2 chloride pump. And which drugs are going to be working here? This is the loop. So drugs which are working here are known as loop diuretics. They are known as loop diuretics. Here you will be having 25% of salt reabsorption normally, right? If we can block this with the loop diuretics, what will happen? That salt will be going into the urine, and along with the salt, water will also go into the urine. Diuretics means what? Di means two things. They are going to remove the salt, automatically water will go away. This is known as diuretic, right? This is going to be the loop diuretics which are working over there. Then comes the third part. This is going to be the distal convoluted tubule. Here you are having sodium chloride pump and calcium pump will be separate, right? This sodium chloride pump is going to absorb what? Distal convoluted tubule is responsible for 6 to 8% of the salt reabsorption, and remaining is going to go away, right? And in the aldosterone, you will be having this particular upper part of the collecting duct where you will be having functioning of aldosterone. It is going to absorb 2 to 3% of the salt, right? So this is going to absorb 2 to 3% of the salt, and this lower part of the collecting duct is concerned with antidiuretic hormone, and this antidiuretic does not involve the salt. So it does not do the absorption of salt. It will be having aquaporins, and these aquaporins will absorb the water. Ultimately, how much urine will be left? Only 1 ml per minute urine is left out of that particular thing. 65 plus 25 plus 6 to 8 plus 2 to 3%. Ultimately, you will be getting how much amount of urine? To 1 ml. And this ml of urine is going to go to your bladder, and whenever you are having filling of bladder, that means around 500 400 ml will be there. You will be having that particular urge for urination, and after the urging of urination, your parasympathetic nervous system will work, internal sphincter will be relaxed, and external sphincter will be under the pudendal nerve. And whenever you want, you can relax your pudendal, you can stimulate your pudendal nerve, you can relax your sphincter, and you can pass the urination. In a day, you will be passing approximately around 1.5 to that is going to be 1 to 2 liter, that is going to be 1.5 liter. If you are passing less than 400 ml of urine in a day, this is known as oliguria. If you are passing more than 3 liter of urine per day, this is known as polyuria. This is going to be a feature of diabetes. Polyuria means someone is passing more than 3 liter of urine, then it is considered to be as polyuria, right? Different drugs we have seen here, and different things we have seen. If there is mutation of this particular pump, this is known as Bartter syndrome. If DCT mutation is there, this is known as Gitelman syndrome. And if ENaC channel mutation is there, this is known as Liddle syndrome. Right? So these are the syndromes we have seen. These are the things we have seen. Just think like that. This is a PCT, then loop of Henle, then DCT, and then collecting duct, and then lower part of the collecting duct. This is what we have seen now. Right? Second thing we have seen is about the RAS system. RAS is related with the BP. Like we have discussed about certain things. So let me just try to connect here. You can decrease the BP here. You can block this particular system. The function of this RAS is to increase the BP. Yes or no? Yes, it is a part of sympathetic or parasympathetic nervous system. Sympathetic nervous system. So can I block this renin? We are having drugs. What is the name of drugs? Aliskiren. This is going to block this renin. We are having ACE inhibitors. ACE inhibitors are the drugs which are ending with the pril. Captopril, lisinopril, enalapril. These are BP controlling drugs. Okay. We can have drugs which is going to block these receptors. Angiotensin receptors blocker. These are going to be ARB. They are going to be what drugs? Telmisartan, valsartan, losartan, all these sartans, right? And then we can block this aldosterone receptors also, right? This aldosterone is going to, we can block the aldosterone receptor. This is going to be what? We are having drugs like spironolactone. Yes, just remember the mnemonic EAT. Okay, apart from EAT is going to be what? Aldosterone blocker. They are going to block the aldosterone, right? So this is how you can use the drugs. So what are the drugs you will be using in that overall BP? You are going to use what? A, B, C, D. A4 we have discussed about ACE inhibitor. Second is ARB. B we can use beta blocker. Now you understand what beta blocker is going to do. We are having alpha beta receptor. Beta blocker means complete heart is blocked. It is going to decrease your heart rate. It is going to decrease your, you tell me, decrease your heart rate. Not BP. BP I have not told you. Okay. It is going to decrease SA node, AB node, muscle. Heart rate will be decreased, conduction will be decreased, contraction will be decreased. BP is a different entity, right? It is going to decrease what? Kidney, it is going to decrease the renin, and now renin will decrease the what? Renin will decrease the aldosterone, and the aldosterone will decrease what? BP. It is going to decrease BP by decreasing the fluid in the body. It will let the fluid go away. You understand this ENEC channel if I'm blocking, this ENEC channel if I'm blocking, what is going to happen? This fluid will be going away. This will decrease the BP. Right? Water retention should not be there. C4, we are having calcium channel blocker. Remember calcium, I'm going to give you three funda of calcium. Anyone can remember calcium three features? In vessel, it is going to cause always vasoconstriction. In muscle, it is always going to cause muscle constriction. And in the cell, it is going to cause exocytosis. This is the complete life story of calcium. Right? So calcium, we are giving what drugs? We are giving drugs. They are known as calcium channel blockers. These which drugs we can use? These are going to be your calcium channel blockers. Calcium channel blockers are the drugs which are going to be there, right? Calcium channel blocker. D4, the drugs that you are going to study is going to be diuretics. You already know, I've told you about diuretics. What you are going to do, you are going to block at certain places. It is going to remove the excess of fluid in the body, and fluid will be away. Means what is going to happen? If fluid will be decreased, suppose earlier it was 5 liter, someone is having 6 liter. What you can do to decrease the BP? Either you can there are only two possibility to decrease the BP of a person. Look here. Someone is coming with hypertension. Hypertension means the pressure exerted by blood on the wall of the vessel, right? And you know this patient is having 6 liter of blood. Now, how you can decrease the BP of this person? Either you can dilate this vessel, either you can decrease the fluid, right? You can give the vasodilators to this patient, or second thing you can do, you can decrease the fluid. I can remove 1 liter of fluid from this particular patient. What will happen? Only 5 liter will be there. Now 5 liter will exert a little bit less pressure. These are the two options of VP decrement. What are the two options? Either you can dilate the vessel, either you can remove the fluid, right? And these are the diuretics which are very well known for the removal of the fluid. They are going to remove the fluid. Like 2 ml of Lasix injection or furosemide injection can lead to 500 ml loss of more urine, right? So that is a good drug that we can use. Apart from that, we are having NO. ABCD ko no, that is going to be nitric oxide releaser. These are the drugs which are going to do worst, ultimately vasodilation. Throughout your life, you are going to use these 5 classes of drugs. For the hypertension, this is the only thing that you will be doing. Okay, do you know anything else apart from this? Anything else apart from this about BP? Then tell me, I'll explain. Nothing else, right? Now we can have a lunch break. How much time do you want for lunch break? 50 minutes. Okay, 50 minutes lunch break. We'll be starting at 3:30 again. Try to eat as less as possible. Okay, so that you will be more active. Speed is okay. After the break, this speed is fine. Are you able to understand? I'm thinking I'm going a little bit faster, but if you are able to understand, I can keep with this speed. Or should I increase some more? This is fine.